Good morning, everyone.
Good morning, ma'am. Good morning, ma'am.
Nalini? Nalini, your voice is not audible.
Is it audible now?
Yes, ma'am. Yes, ma'am.
We can start.
Yes. So good morning, everyone. And let's start today's program with the prayer. I request Mr. Sridevi, PhD scholar of MAHER, to host the prayer.
वक्रतुण्डमहाकाय सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा ॐ शान्ति 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 सहना भवतु सहनौ भुनक्तु सह वीर्यं करवावहै तेजस्विनावतीतमस्तु मा विद्विषावहै ॐ शान्ति शान्ति शान्तिः.
Thank you, Sridevi, madam. And I request Kamakshi, PhD scholar of MAHER, to present the welcome address.
Very good morning to one and all present here. I would like to welcome you all for the International Faculty Development Program 2020, organized by Yogalaya Healthcare Institute of Chennai and Faculty of Yogic Sciences and Therapy, Meenakshi Academy of Higher Education and Research, and combined with Indian Yoga Association, New Delhi. Nowadays, women are equally working and contributed themselves in all fields. And she is also very responsible for her family and also women health getting more affected due to lifestyle changes. Today, our faculty development program will cover the women's disorder and their remedies by yogic practices. And once again, welcome you all for the International Faculty Development Program. Thank you, one and all.
Thank you, Kamakshi. And our first session of the day is our chief guest is Dr. Dakshayani. I would like to give the introduction of her. Dr. Dakshayani is the gynecologist and infertility specialist in Annanagar, Chennai, and has an experience more than 20 years in this field. And she is a senior consultant at Apollo Fertility in Annanagar, Chennai, and has been associated with Apollo Fertility right from the inception of the center. Her education qualifications are: she has completed her MBBS from KIMS Bangalore and DGO from Dublin and Diploma in Reproductive Medicine from the Germany. Welcome you, ma'am. Where is she? She's having some network issue. I'm just looking into it. Dakshayani madam will be joining shortly. So in the meantime, our head of the department, Dr. R. Ilangovan sir, will give the speech related to women disorders. Welcome you, sir. Over the session to you.
Hello.
Good morning, sir.
Is it audible?
Yes, sir.
Good morning, sir.
Good morning.
Morning, sir. Good morning. Good morning.
So very good morning to you one and all.
Good morning, one and all.
I hope you are enjoying the sessions. Today also important sessions you are having. And what my suggestion is, you note down the points, what they are telling. It would be beneficial for you in future. Yesterday, very good talks that we had, very particularly nutrition. That is one of the main concept that we have to follow in our life. And for your kind information, as because it is related to women, I want to tell you that the first 3 years after conceiving, all women after conceiving, the first 3 years are very vital period. It is your duty that you have to promote yourself to safeguard the generations. After conceiving that, you might have known, there are yogic practices available for throughout the life of women, from birth to death. And whatever problems that you undergo, you are having remedies in yoga. That's what yesterday they told. If you have problems in amenorrhea or dysmenorrhea, or during pregnancy, menses period, before and after menses period, menopause stage, everything you are having practices, yogic practices. At the same time, you have to follow food habits, proper food habits. And also you have to concentrate on your sleep pattern. If you follow these 3 concepts, definitely your life and your generation will be good. And for your kind information, regarding yogic practice, I told the first 3 years. At the same time, after birth, the first 5 years of the child, what you are giving food items, that plays a very major role. I told 2 points. One is from conceiving the first 3 years. That is essential not only for pregnant women, but also the newborn baby like that and all. After birth, the first 5 years of the newborn baby is very much to be considered. If you concentrate on their health for the first 5 years, then you no need to worry. They will grow and develop as they like. So these things that you have to keep it in your mind. So in that periods, you have to concentrate on yogic practices, sattvic diet, and also proper sleeping pattern. That's what first 5 years of the child regarding nutrition. You should not give too much of red meat. It is better, not even red meat, whether it is chicken or fish or egg, don't give too much. And also you avoid completely the red meat. That is the important point that you have to keep it in your mind. At the same time, you see to them that they have proper sleep. Proper sleep pattern also lies with our lifestyle habits. For example, it depends upon biological clock. Whether you or your family members or your children, whoever might be, try to take dinner before 7:30 p.m. and don't avoid breakfast. That you take before 9 o'clock. So if you follow these two main principles, definitely the biological clock, though it is being affected, can be set right. You can reset the unwanted biological clock. So that you have to keep it in your mind. And regarding yogic practices, yesterday I told you the hormone secretion, estrogen, plays a very, very vital role. You should not secrete too much or you should not secrete too low. If it secretes too much, then there is a possibility for getting amenorrhea. If it is secreted less, there is a possibility for getting infertility. So in order to have the proper secretion of estrogen, the same 3 points that you have to keep it in your mind. Do yogic practices, follow proper food, balanced sattvic diet items, and sleeping pattern. For your kind information, if your secretion of estrogen is good and during pregnancy, if you do yogic practices, there are certain yogic practices even during pregnancy time. First 3 months what to do, second 3 months what to do, final 3 months what to do. Everything you will have practices. So in that sense, if you do yogic practices, there is a hormone secretion called apelin. That apelin will secrete in a proper shape, proper condition, proper amount, then that will lead to your metabolic health. Now you can understand what is the meaning of metabolic health. Metabolic health related to your blood sugar level, BP level, lipid profile, that is total cholesterol, triglycerides, LDL, HDL. So these concepts that you have to keep it in perfect fitness concept. So metabolic fitness you have to develop. If you want to develop the metabolic fitness, then you ought to undergo for the secretion of apelin, which is controlled by estrogen again. For that, you have to go for proper yogic practices and also proper sattvic diet. 1 minute. Hello? நான் அனுப்புறேம்மா, நான் ஒரு மீட்டிங்ல இருக்கேன், நான் அனுப்புறேன். ஓகே 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 தேங்க்யூ தேங்க்யூ. ஓகே அனுப்புறேன். தேங்க்யூ தேங்க்யூ தேங்க்யூ. So during pregnancy, the hormone called apelin should get secreted properly. For that, even during pregnancy time, you have to do yogic practices, and you don't get offended that, but you should have what practices you have to do. So you follow these principles, and already I told you all practices for all facets of women life, where you are having yogic practice. So you keep on learning many things, and again, if possible, we will have discussions again further. Now the guest is ready, and be ready for your further getting information. Thank you. Thank you very much.
Thank you, sir.
Thank you.
Thank you. And now I welcome our chief guest of the day, session 1, Dr. Dakshayani Madam. Welcome you, ma'am. And I'll give short introduction about her. Dr. Dakshayani is a gynecologist and infertility specialist in Ananagar, Chennai, and has an experience of more than 20 years in this field. She is a senior consultant at Apollo Fertility in Ananagar, Chennai, and has been associated with Apollo Fertility right from the inception of the center. Her education qualifications are MBBS from KIMS Bangalore and DGO from Dublin and Diploma in Reproductive Medicine from Germany. Welcome you, ma'am.
Om Gurubhyo Namaha. It is a pleasant morning, and I pray my salutations to all the senior person in the team, all the doctors involved in such a good program. Elil is my good friend, and I have known her for a long time. And I heard Ilangovan sir is creating a big awareness of all the programs in regards to women's health. And I was very happy when she invited me. So I said, like, because my interest is fertility and I know how much of importance yoga and fitness is, and I keep telling all my patients about it. So I said, okay, I will talk about fertility and fitness and role of yoga as a very big important, both as prophylactic as well as therapeutic way in managing our problems related to fertility. Namaste to everyone. Shall we start, Elif?
Yes, ma'am, we can start.
Okay.
Yes, ma'am.
So fertility and fitness, I bring both of them together here. It's because, like, we all know, although our country is known to be one of the most populous country, but we also know that almost 15 to 20% of our women patients coming into a gynec clinic or a women's clinic, we see 15 to 20% of them are suffering with infertility. So we know what infertility is. It is inability of a couple to conceive and reproduce in a period of 1 year of regular intercourse without contraception. So if they are like that and they find it difficult to have a progeny, then we call it as infertility. So going forwards, the types of infertility, we call it as primary infertility and the secondary infertility. Next slide. Can I have the slides on? Okay. Primary infertility, when the couple has never been able to, when the woman is never able to be conceive even once, like she never had a urine pregnancy test positive even once. But in secondary infertility, it is like either she had an earlier pregnancy with a live birth and a child, or she had miscarriages earlier. She got pregnant, but then she had miscarriages. So we call this as and now they're trying for a probably their first child or subsequent children where it is being not possible. So in that case, we call it as secondary infertility. So we know that like it was like long time before, like when there is a infertile woman, people used to blame her for not getting pregnant. But the scenario is entirely different when we are going on the statistics. So we know that the percentage of the factors which are causing for infertility in women has not only been to the causative being woman alone. It is, we have the male factor, we have the female factor, we have combined factors, and we have the unexplained factors also over here. Next slide, please. Yeah. So in infertility causes, we are seeing here that there is almost 30% as the male factor alone, and another 30%. So that means to say equal number of problems we see when we see them as a couple in our clinic. So it is 30% of them are having in male, there is a reason, and in 30% we see the female factor also. And combined factors, like for example, there could be a less count in the man, and the woman also has some tubal problem or a polycystic ovary and such things. So we are seeing combined factors in 10% of patient. More than 20% is seen as unexplained. So we see the man and woman seem to be normal as per our investigations or as per our clinical assessment, but then we see like 20 to 25% are still unable to conceive after giving the basic therapies, and about 5% are others, like it could be anything, right? Starting from uterine anomalies, or it could be something starting with sexual disturbances in them, or the libido problem. All those things comes over there. Okay. Then talking about how we manage, like we have a host of causes where female infertility is concerned. So female infertility, you have the uterine problems, we have the ovarian problems. Ovarian problem as in what we see as polycystic ovaries, and as in we see the endometriosis or endometriotic ovarian cyst causing adhesions and tubal damage. We see problems like pelvic infection. In India, we still have tuberculosis as one of the important chronic problem. So even there, the tubes are damaged, or even the uterine pelvic environment is changed. There is lots of adhesions around over there. The next slide, please. So again, one more important thing is the age, polycystic ovary, endometriosis, hormonal imbalances. Just now, Dr. Ilangavan was explaining to us, there is lots of hormonal imbalance because of the lifestyle change we are undergoing. And uterine factors, as in like uterine tumors, myomas were commonly seen, or it could be a bicornuate uterus or septum in the uterus, all those things. The fallopian tube blockages because of infection and endometriosis again. Ovulation problems, as we were talking, it's about the hormones where people are not ovulating at all. There is no egg formation on a menstrual cycle, on a particular menstrual cycle, especially in polycystic ovary people. Their cycles are so irregular, or sometimes they might have cycles, but they don't ovulate at all. So complications from previous surgeries, previous childbirth, or previous sometimes even we have seen an appendectomy could cause tubal damage or tubal adhesions also. So previous surgeries also has to be taken care. Recurrent miscarriages, decreased egg reserve, because we are seeing that there is a very much delay in marriageable age in women also these days, especially the urban society. We are seeing most of them are getting married very late in this thing. When earlier we used to see like 23, 24, we see the families getting ready for their daughter to be married. But now girls themselves are opting out to the age of 27, 28, where they feel that they're monetarily secure, or they go into a job, they're sort of, whatever they call it as, they want to have a settlement before they go into it. And of course, the eating disorders and the lifestyle problems we are facing over here. Next slide, please. So coming to the male infertility, again, it is actually about the sperms. It could be the various factors which is causing the person or the man to become the cause or the factor for infertility. That it could be the count will be lesser than normal, and it could be the motility of the sperms, or it could be the morphology of the sperms. Even if the sperms number or the total count is very good, like it's very well above 15 million, but then if the morphology is very poor or lesser than 4%, that also can cause this thing. And for urban society, or like what we are seeing now, like commonly in our clinics, we see lots of patients or lots of couples who are working in IT sector or in those high strung offices like bank back offices and such places. You see that they are not having much time to themselves, or as a couple they're not spending much time. So when it comes to this, and they're not concentrating well on their exercise, on their diet, then these are the persons who really have this imbalance in their sperm parameters. Like the count could be less, the motility of the sperms could be impaired, and the number of sperms also could be, which is normal, that is morphological normal, would be very, very much less. Actually, according to the Kruger's criteria, it says only 4% of sperms, if they're morphologically normal, it is considered normal. But when we see our patients' reports, we are seeing much lesser than that are having like lesser number of sperms, like they're much lesser than that, like 1%, 2% they have, and some of them very poor morphology reports also we see. And coming to something like previous infections of the male tract can cause obstruction. So we have what we call as obstructive azoospermia also. And there could be non-obstructive azoospermia, where there is no sperms in the given sample of semen. And it could be because of either an obstructive or a non-obstructive cause. So if it is an obstructive one, yes, we can still find a way, because IVF and YHCI methods are all going to be very, very helpful in such cases. But in non-obstructive, we know that it is because of the primary cause being the testicular failure. So we see that the hormones in the man would be deranged in that matter. Next slide, please. So again, around 20-25% are unexplained. So we try to, like on the clinical aspect of it, we try to do further more investigations on them to find out, do we do a hysteroscopy and a laparoscopy in the woman to find out whatever findings we have found on a HSG or something is being made sure. And by doing endometrial scratching now, we know that there is a possibility of implantation, better implantation. So further investigations on the male also to find out if there is any genetic reason. We do karyotyping in the couple, both the male and female. So further, we go for higher tests to find out if there is any reason for unexplained infertility. Sometimes, even doing all those investigations, we see everything is within more normal, but then they don't conceive. So explanation given by the scientists over here is like probably the thickness of the eggs is being too thick, or the acrosomal cap on the sperms is not having a good amount of hyaluronidase, which is necessary to bore into the eggshell. That is the oocyte, the outer capsule of the oocyte. So these are more of scientific literature says, which helps us so that we take those patients with long-term unexplained infertility to IVF and such programs. Next slide. So challenges of infertility and how protective the yoga therapy is. So coming to the main help, where keeping oneself fit and keeping to have a better outcome of fertility, we know that reproductive health problems along with fertility in male and female is often observed. So various assisted reproductive technologies is there. So we have lots of technologies also on the clinical setup, which is helping our patients. But we can't expect everyone to come into that treatment immediately. So we try to help them by giving various holistic way of approach for the treatment of fertility. So although I am into allopathic stream, I don't mind various treatments like Ayurvedic and alternative medicines also when they're going to help us. With regular yoga practice also has been proved very effective in the reproductive health of the woman. So it is not only by the keeping them fit, it also increases their mental strength and by that their positive attitude, so the hormones in them and the chemical substances which they release will give us better function of the female and the male genital tract also. So this is actually by reducing the stress and the anxiety, which improves the autonomic functions by triggering neurohormonal mechanisms by suppression of sympathetic activity. So today several reports suggested yoga therapy and yoga practice are beneficial in reproductive health also. Next. So to have a healthy you and a healthy baby, it is very, very important. Like we are looking at a healthy society. If it is about our nation, we should be worried. So it's just not at one household or one family. If you have healthy children, you have a healthy outlook at at your country also. So any future pregnancies, we would always want the healthy outcome of a pregnancy, because gone are those days where people used to have 5 to 6 or even 10 children in a household, and you don't mind even if one is Down syndrome and one had some problem or one had a CP and all those things. We have seen, if we are looking back into our own families, into our grandparents and all, we see that there were quite a number of children, and some of them had neonatal deaths, and some of them had something like Down syndrome or a CP baby or something like that, cerebral palsy baby. So, but now the world is changing, the outlook is changing, and we want to have healthy children at the family, be it one or two baby norms as child norms is what many people are following now. So you are wanting to have that one child or even two children to be very healthy. So to have a healthy pregnancy, it is very, very important that the woman is very healthy right from the time of conception to her time of delivering the baby. So even to conceive a holistic way, that is bringing our form of exercise, that is yogic practice or yoga and related exercises, as her type of physical exercise will be very helpful for her to have a early pregnancy or a healthy pregnancy, and come out, I mean, make her have a chance of going into pregnancy without much treatment, as I was trying to tell. Like we do offer IUI, we do offer IVF, I offer higher technique of treatments these days. But then I would want my patients to like try and see if they can, like if I'm having a obese girl coming into my clinic with a PCOD problem and she has irregular periods for a long time, because I have seen very young girls going to schools and colleges having irregular periods, having very much as a increased BMI. We are seeing young girls of 17, 18 coming with a BMI of say 28, 30 and all. That is, they'll be almost about 10 to 15 kilos above what they're supposed to be according to the chart, their height and weight chart. Next slide. So fitness, as I told you, to have a healthy couple, healthy relationship, fitness is very, very important. And as a part of fitness, I would put yoga and meditation, because as I was telling you, most of the couple or most of the younger generation now are career oriented. So they are like wanting to do very well in their career, they wanting to do very well onto themselves, like educate themselves better, earn better, having a living better, and more of materialistic attitude has been there. I mean, it's there everywhere. I'm not putting it as a blame. It's become sort of an accepted reality amongst the youngest generation. But then it's time that we bring back our old cultural important things in what our older people or older generation followed into use over here, so that it will help our society. We should be thankful to our Prime Minister Narendra Modi ji, so that who has made yoga as a practice and put it on an international platform. So we all know how much it has been practiced, and I think June 21st is considered as the International Yoga Day also here. So coming back to conception and having healthy couples for to have a healthy outcome and offspring is very, very important. Next slide. So these are some of the yoga poses which can boost the fertility. So it is the different asanas. I think Elil and their team of people will be in a better position to explain to us about the asanas over here. But they all try to improve the blood supply to the genitourinary tract. Next slide. So coming to yoga and fitness, how it helps us. If yoga relieves stress, which can negatively impact your ability to get pregnant, research has found that yoga and fitness seems to help undergoing fertility treatment. So this is more of a data. So in review of about 87 studies on yoga, found that regular yoga practice may improve the outcomes of women going through fertility treatment. So it is like before you start a family, probably people like what we tell, taking folic acid is preventing a person from having a baby with neural tube defects. I think suggesting our patients or suggesting our people whom we know, if they are planning to start a family, to tell them and take some yoga therapy or doing yoga exercise and making it as a practice in them will help them have a better outcome when they're going for pregnancy, and even for normal deliveries also, yoga practice or having yoga exercises will help them go through the natural delivery process also, more importantly. Next. So if you're hoping to achieve your dream of becoming a mother, fertility yoga should be on your radar also. So fertility yoga is designed to help women nurture, support, and strengthen their reproductive system so they can conceive their child on their own, or maybe with little help from the medical point of view. Next. So, as I told you, what are the important points through which yoga could help a person or a woman or man or as a couple is by lessening their stress. So, it's the most common causes of fertility issue is of the demanding job you have, the financial struggles you have related to it, or a busy personal life. If you see many young people at 30, 35, they're literally like almost on their laptops most of the time or on their calls most of the times. So that element which causes lots of stress in them. So by doing yoga on a regular basis, this reduces their stress levels. So since feeling stressed or anxious can cause fertility problems, fertility yoga is a great option, and it can lower your stress levels and may help you become more fertile. It is both for man and woman. Next slide. So increase blood flow to the reproductive organs. As I told you, all those yogic postures or yogic exercises which is being told by our yoga therapy persons to our patients sort of makes it improve the blood supply to the reproductive organs. So it improves the blood supply to the, like we all know, they speak about the chakras and opening up of the chakras, and it is in their language. But if I am telling it on the medical point of view, it helps the sympathetic nerves, and it helps the blood supply to the in a woman, it helps the blood supply to the uterus, her ovaries, and the pelvic organs as well. And in men, of course, it improves the prostatic seminal vesicle and the testicular blood flow also. And to improve the blood supply to those things means to improve the production of the spermatozoa in them as well. Next. So greater positivity. So when you are like trying to do one yoga, like if people who are trying to do regular yoga in their houses, they see that about 5 minutes of deep breathing or even the pranayam we are trying to do, we see that we have lots of calm in our mind, like, and that calmness is always a strength. So which actually improves our positive thinking, and it calms down our nerves, and whoever we are talking about are like more stressed out or more into busy active life, and the changing lifestyle now which we have gone into the millennial world. So in those things, giving a 10-minute or a 15-minute short break and having a little bit of that breathing exercise can actually make us more calm and composed also. So a more positive mindset can increase our chances to get pregnant. Next. So reduce side effects of fertility drugs. We all know, like I might be a doctor, I might be suggesting many medication, I might be writing lots of prescription for my patients, but I know that most of the medication I'm writing, even if it was a paracetamol which has been written for a body pain or a fever, we know that it has one host of side effects on it. So when we are talking about fertility drugs, they are all a bunch of hormones. So when we are talking about hormones and prescribing lots of hormones in our patients, we know that we are actually causing lots of tiny side effects in them. I mean, the bigger ones, as I know, like when we are using too much of estrogens, we know that in a person who has a thromboembolic situation, if they can have some problems with their clotting factors, our drugs can actually make them or worsen their chances to have a DVT or some emboli process in their body, which could be very dangerous. So when we can combine, like by being holistic in our treatment or holistic in our approach, when we are telling our patients to combine yoga therapy or combine some sort of a fitness therapy into their treatment protocol, we are seeing that the usage of our drugs dramatically or drastically reduces. And in many patients, we might not go as far as giving an IVF therapy or a treatment with furthermore therapy, where actually it involves lots of patients' time, psychological involvement, and monetary or financially also they are burdened with the treatment we are trying to give them. Next slide. So we already spoke about this. Hormonal balance is the main thing which is necessary for any person to have a healthy pregnancy without any treatment. Maybe, as we said, as they have planned, probably even if they've not planned for 1 year, or when they plan, if within those 6 months, if they're able to conceive, that means to say their hormones are in good state. So hormonal imbalance is one of the most common things which is related to fertility. So a healthy endocrine system, that is a network of all our glands, right from the hypothalamus, pituitary, and then you have the thyroid over there, and you have your ovarian and the hormones related to our pelvic organs in women, and in the men, like it is the prostatic and the seminal vesicles, which are, and the testicles, which are actually producing some of the hormones, sex hormones related over there. So all this net of hormones, right from the top to the bottom, like what you are explaining about your chakras, we have a set of hormonal or the glands which are producing important hormones for us to have a healthy pregnancy and carry on with a healthy pregnancy with the outcome of a healthy life baby. So yoga helps you keep your hormone level under control. Next. So one of the very important or very close to my practice is polycystic ovarian syndrome. PCOS is polycystic ovarian syndrome. We call it as PCOD also, that is polycystic ovarian disease or polycystic ovarian morphology. So each text or each person defines it with this different, I mean, the terminology slightly changes, but we all know that it is not only the cyst in the ovary, it is a syndrome by itself, which can actually affect many systems in a woman's life. So like it could be like she is having irregular periods, she is unable to conceive, that is infertility is one of the biggest problem. She is obese, she has hirsutism, unwanted hair in the upper lip, chin region at anterior abdominal wall, or male distribution of hair with baldness occurring also. So all these things, and of course fertility, because when it comes to PCOS, we see that the end point would be they are coming into a fertility clinic for seeking fertility treatment. So here we see that it is a vicious cycle. It's not just the hormones, because of the polycystic ovaries, that the ovaries produce extended hormone release of estrogens and all. So they have that irregular cycle. Some people might not get periods for about say 3 months, 6 months, or sometimes they get only periods only when they're given some medication. So these people actually, because of their abnormal hormones, they are not producing eggs and they are not ovulating also. So their chance of getting pregnant also is being very less, because they're getting periods only once in 3 months or once in 6 months. So that means to say, like in a year, 2 to 4 times only they get periods, and that too with medication. And most of these cycles are anovulatory, though they don't seem to produce or release an egg at all. So these type of people will have, because of this abnormal hormones, they tend to get put on too much of an excess weight. That is, that the fat distribution has becomes very much high in them, and they have all these acanthosis nigricans, lots of skin problems because of that. And they will have problems like abnormal hirsutism, that is the male hormones are becoming more prominent for them. So ultimately these are the people who land up in fertility clinics also to have further treatment, and that is going to an advanced treatment. So this set of patients, I strongly suggest them, like all patients entering to my clinic with PCOD, or I diagnose them to have PCOD. My first advice to them is about diet modification. Of course, diet also is important, because the food fads and the fast food things are more, which is actually driving most of our younger generation into quick, making something quick or picking something quick and having it as a breakfast, lunch, and different times of their in their diet timings. So I tell them that diet modification is very, very important. They have to make healthy food for themselves, or at least at their place, or make it in take it in a place where everything is balanced, has been taken. And the next important thing for them, I'm telling them, is go join a yoga class or have a guru, so that you can start following right from whatever time they're trying to see. Because when I'm talking about infertility patients, I'm seeing them few years after their married life, or maybe 1 or 2 years after married life. But I myself have not less than 50 to 60 girls coming to me of various ages, from 17 to 25, 26, where they're still not married, but then coming with polycystic ovaries. So my advice to them is, please join into some fitness program, and I would prefer them to go in for yoga, so that they will start exercising. Their mental health also is better, because once they're out of shape at that age, everything changes for them. Their outlook and the way they think about themselves, everything changes. They sometimes they don't mind being 110 kgs. So their mental acceptance also sort of changes. So I make them make it a point that they go and join into some yoga center, or like direct them to the people whom I know as yoga practitioners or yoga teachers, so that they can help my patients do it. So in PCOS, simple one of the disorders which can pause yoga is a positive help I have seen, and many of my patients have been benefited by it. So the science of yoga works at all levels, much subtler and deeper than just the physical body level. So yoga helps release deeply stored stress in the system and can improve the PCO symptoms. So we see that there is a I mean, once they start into yoga practice, we see them that they're improving on their health, their weight reduction happens. Of course, we do help them with giving metformin and such medicines, where they're when they're trying to reduce their weight. It actually helps their fitness program. I mean, commonly I'm suggesting them yoga, but then anything else also, I give them some co-medication or co-prescription along with it. Next slide. So process challenging motions, it is very important when you're, I mean, everything seems to be a challenge to us when we are actually trying to do on a program. It's not very easy to make people to immediately accept something and start going on it, because it is not just to start, but to stick on to the program and get some positive effects out of it. So this offers us a space for work through challenge and building of the science. It also allows us to sit with discomfort by challenging us to hold it longer than we like, knowing that it's not a temporary thing for us to go on the treatment. So, but being on treatment and being on something like this is emotionally, as well as by making them positive thinking and improving their hormones also, it is going to be very helpful for them. So it is important that we continue doing all these programs once we are putting it onto our patients. Next slide. So again, not only fertility, not only health, by doing yoga, you are trying to reconnect with yourself. So I think most of the therapy doctors over here who are into the treatment and practice over here would agree with me, or that is what you people advise. It's just that you're not talking about health and you're not talking about anything related with fertility, but to come out of our daily hustle bustle of life and be taking care of ourselves, or taking care of oneself and focus on ourselves. It is like reconnecting with yourself. So it helps a long way. It is not only for fertility, but it is the general psychological women's health also. I feel having a 15-minute or a half an hour session on a day on themselves will be helping them to rejuvenate on a daily basis, or they're trying to reconnecting themselves, so that negativity in them would really go off. Next. So as I've already told, incorporating yoga into daily life may help following stress, anxiety, and regulating the body function, and support in men, support sperm function also. And it is always important that we are trying to tell that this is brought into our regular type of therapy, like to help or incorporate. Even in hospitals, there should be a small unit where our patients are regularly able to reach out into yoga practitioners also. So it is going to help them in a wrong way to treat most of our patients coming with infertility problems. Next. So to conclude, I would holistic approach towards fertility. I always consider, and I know that there is scientific evidence, as we have discussed earlier and saw some of the scientific based studies done, that yoga is going to be very beneficial in all our fertility related patients. So to improve their reproductive health, as well as have a healthy pregnancy, have a healthy outcome, and having a healthy outcome means that we are going to have a really, really healthy society on the whole. So thank you very much for giving me this opportunity over here, and hope whatever I spoke and is going to be of little help. And I would really want to take it forwards, like most of the fertility centers or gynec centers who are dealing with women's health would incorporate yoga into their regular practice. I'm a person who's already trying to tell. I know many schools are doing yoga, but then they're doing it as a curriculum, just as a weekly basis. But they should take it forwards to see that our children's mental health also improves a lot by taking it onto a regular or a daily basis into the routine curriculum. So when we start young only, probably we accept it as we grow older. That is what I feel could happen as a very big change over here. Thank you very much.
Thank you, ma'am, for your wonderful presentation about the fertility.
Thank you, ma'am.
Major cause of
Thank
it.
you, Elil.
And
Ma'am, one question, ma'am. In case of fertility due to endometriosis, can you guide about blood flow to uterus? So in
Yes.
which way we can increase circulation to uterus, ma'am?
Yeah, as I told you, no, most of these endometriosis is by itself a medical angina as far as the gynec clinic is considered, because it is sometimes becoming a very, very difficult one to treat also. But if we are going to see endometriosis in its early stage, as you said, increasing the pelvic blood flow can improve the ovarian function, because in endometriosis we are seeing the ovary is being sort of replaced with the blood which bleeds within the pelvis, and those causing the pseudocysts over there. The pseudocysts are nothing but the chocolate colored fluid, that is the altered blood which gets collected within that area, and it causes cysts over there. So this, by their change in the genetic factors also, it starts reducing the anti-Mullerian hormone of the woman. So we have seen very young women at the age of say 27, 29 who had large ovarian endometriotic ovarian cysts will definitely require something like a laparoscopy to eliminate or at least maximum take out the cystic portion of the ovary over there, and release, if there is any adhesions around there, release the adhesions over there. And then probably as an adjuvant therapy, I would really recommend yoga over there to improve the blood supply of the pelvic organs. Because in this cases, we can't be postponing pregnancy for a long time. So you have to incorporate one or two programs where I would consider yoga also as important, because these days we are doing only laparoscopic surgery. So not more than 1 week or 10 days of rest we are recommending. So the patient can go into any of these treatment immediately to improve the blood supply of the ovaries, so that her AMH or those hormones are not falling down very quickly. Because once the AMH level falls below say 0.5, many a times we are forced to tell a very young woman at the age of say 29, 30, 31, 32, who is very young. Because I told you, these days women are trying to, I mean, at least the urban women are trying to get married only at the age of 28, 30 and all. So keeping those things, I have seen, and I feel sad also that I have even recommended them to go for oocyte donation at that age. That's because their AMH level is like say 0.3, 0.4. On their request, we do try to stimulate them, but then we see that there is no follicle developing at all. So considering yoga in endometriosis also will be very beneficial if we are seeing the endometriotic cyst in a very early stage as a primary thing. But then if we are seeing a larger cyst and we know that that would have caused some adhesions, because we can make out by a pelvic scan that the uterus also is retroverted, pulled, tilted, all those things. So if something like that is there, then we would do a laparoscopy and then add up or try to put in yoga therapy over there to improve the blood supply along with that after the surgical therapy, and along with that help them to conceive as early as possible. If the tubes are patent, naturally, if the tubes are not patent, then we would recommend them to go for an IVF therapy.
Ma'am, one more question.
Yeah.
How does yoga helps to solve hyperprolactinemia, which is the initial cause for one of the cause for infertility?
One of the
right?
causes, yes.
So how yoga helps? Yes, ma'am.
Yeah, I was just now telling.
So will it be yoga helpful for that problem?
Surely, because I was just trying to tell you about like the various chakras you people explain about and how it helps by doing yogic practice. Okay, but the same line we see in our body, right from the hypothalamus, we see important glands sitting over in those positions. So all these glands are the main reason for the normal hormonal function. So if you are talking about hyperprolactinemia, that means the pituitary hormone, the pituitary gland has been the cause for it. Look, there might be some real reason also for it. Like real reason, I mean to say, there might be a microadenoma or a macroadenoma of the pituitary. So in those cases, an MRI will let us know whether there is such tumor, that is tumor of the pituitary, which has to be treated essentially by the neurological team or the neurosurgical team. But then there might be hyperprolactinemia without any tumor over there. So those things definitely will be benefited with yogic exercises. And we have some drugs for it. For example, we have cabergoline, which actually reduces the prolactin levels very quickly. Like maybe 6 weeks, we bring down the prolactin level normally. But as I was trying to tell you, everything has medication. It's not that medication is not available. But when I'm talking about yogic therapy or talking about your science, that is the yogic science over here, I feel that it is one of our very, very ancient system of treatment itself, which was practiced, but over a period of time, and because of the changing lifestyle, we have not been able to utilize what is natural. So we have come out of the natural things and trying to put drugs in place of that. So if you are able to make it as a practice for most of our people, or make them understand and accept it, probably our usage of medicine will drastically come down, and our usage of different techniques in helping our patients for pregnancy or making them get pregnant would be really would come down, thereby lessening their chances of having the side effect of the drugs which we are using. Because you would have heard definitely people going in for IVF therapy are frightened that they would go one day obese, or they would like go out of shape at one time. So I feel like if we are going to bring or incorporate yoga and fitness program into a woman's life, then probably she would be having a better chance or an improved chance for conceiving naturally also. Hope that answers your question.
Ma'am, thank you, ma'am. There is a lot of questions in the chat box. Anyway, we are running out of the time, so
Okay.
we'll check with you personally and you will answer to them. Thank you, ma'am, for your wonderful time. And the topic was very excellent and which is really needed at this present moment. And you have covered the reproductive health in all perspective, in the scientific approach, yogic approach, diet way, everything. Thank you so much, ma'am. Thank you, ma'am.
Thank you so much, ma'am. Thank you so much.
Thank you, ma'am. So our next chief guest of the day, Dr. Smita Arun, she's waiting. Yes, welcome you, ma'am.
Thank you.
Give introduction on her. Yes. is Smita Arun. She is the one who is Ayurveda specialist, studied BAMS at SDM College of Ayurveda, Udupi. And she worked as a center head and consultant physician in Ayush Therapy Center, Cochin. And she is currently working as an Ayurvedic consultant and Panchakarma specialist in leading gynecologist firm Triangle Women's Center, which is at North Carolina, USA, and a certified medical office administrator and medical coder. Welcome you, ma'am. And her
Thank
topic
you.
of today is Ayurveda for PCOD. So next 45 minutes we will be in the very good thing. Yes, we are waiting for you, ma'am. Thank you, ma'am.
Thank you. Hi, my name is Smita Arun. Thank you for joining the session and giving me this chance for participating in this international seminar. So since we have very less time, I am directly going to our session. Namaste all. Next slide. So as you all know, Ayurveda, the meaning of Ayurveda. Ayurveda consists of two words, Ayu and Veda. That means Ayu means life and Veda means science. So Ayurveda is speaking about the science of life. Next. Now when we comes to Ayurveda and women's health, you all know a woman's life, if you take,
Nalini, make it full screen.
She is going through so many stages throughout her life. Like we can say Balika. Balika means a small girl, Kumari, a teenager, and then Rutumadi when she attained her puberty. Then Rajaswala, that means she is going through her menstrual age, and then she is becoming Garbhini. Sutika, Garbhini means pregnancy, then post-delivery, and at the end, menopause and menopausal symptoms. So see how complicated it is to go through all these physical and mental changes. Along with all these things, expectation on a woman being a housewife and giving birth to babies has been changed to a multitasker, like she have to take care of all these responsibilities whatever existed earlier. Along with that, she have to contribute to the financial support of the family too. So along with all these responsibilities and changes, healthcare changes also came to her life, and that obviously leads to health issues too, mainly in the gynecological conditions and disorders. That's where the importance of Ayurveda comes. Ayurveda always explain how to care a woman's health during all these stages by stages, and that include generally dinacharya, ritucharya. Edil, can you please go back to the previous slide? Dinacharya, Ritucharya, Rajaswala-charya, Ritumati-charya, Garbhini Paricharya, Sudika Paricharya, all these things. In this, next slide, Dinacharya and Ritucharya consist, the Dina means daily and Ritu means seasonal. Seasonal diet and regimen to follow for maintaining a healthy life. That all you all are always hear about who talks about Ayurveda and healthy life. You always used to hear about all those things. So I am skipping that Dinacharya, Ritucharya part, and I am coming directly to the Rajaswala Charya and Ridhumati Charya. Next. So, Rajaswala Charya and Ridhumati Charya I am taking together because these two are interconnected. So, Rajaswala means a menstruating lady. So, during this menstruation life, ladies, like by recognizing all the changes in a woman's body during menstruation period, Ayurveda have explained how to take care of during this period. thus maintain the three doshas, which is Vata, Pitta, and Kapha in her body in to bring it to the equilibrium so that she can lead a healthy life and maintaining a healthy menstrual life. Along with all these things, Ayurveda have explained some certain do's and don'ts also during her uh, menstrual periods, menstrual cycle. So when we start with all those things, I have to tell, I will start with light, warm food. Do's, in the do's, they have explained light, warm food and healthy drink she have to follow during her menstrual cycle, because this will improve her uh, weaken digestion and digestive power, and it will not alter her digestion also. So avoid consuming uh, certain tastes too much, like katu, ushna, tikshna, amla, lavana, adisikda, guru foods. Katu means it's pungent taste, ushna means hot, and tikshna means spicy. Ushna means hot, means it's not the warm food. Ushna means the ushna tikshna ahara. It is spicy hot food. And amla, sour taste too much. And lavana's taste, lavana means salty too much. Atistikta, too oily or too heavy food, which is very hard to digest. All these things, when she is consuming, that is altering her digest already weakened body during because of the menstruation and hormonal changes in that time. So her body is already weakened, so that will lead to indigestion or uh, stomach disturbance, all those things. And we can modify these advices to uh, modern lifestyle. We can modify all these to the current eating habits of the girls or working class of women, or even uh, s- uh, old age, middle age women also. We can see like they are consuming lots of junk foods, all these frozen cold fruits, highly carbonated sugary drinks, caffeine, uh, tea, all those things. All these can be avoided at least during her menstruation, uh, menstrual time. So when it is coming to Divasapna, I am taking Divasapna and Jagarana together, because Divasapna means day sleep and Jagarana means awake in the night. So avoid sleeping during daytime, and equally give importance to sleep during the night time. That yeah, if you go through current working class people, you can see like their work time is altered, and they will be working till 9 o'clock, 10 o'clock, and they will be going. Then after that, they are having food, and then going to bed at 12 o'clock, 1 o'clock, waking up very late in the morning, like 9, 10. So this all these things when you are doing, you are changing the body's biological clock also. So better not to change that, and try to maximum and to follow a proper sleep pattern also will help you to stay healthy in, especially during the menstrual time. And observing celibacy, so not indulging in sexual contact, because obviously her body will be very weak. So that time indulging in the sexual contact also will make her weak. Next slide. And same way, what is altering her menstrual uh, healthy menstrual life is uh, emotional stress and strenuous exercise. Along with that, we have to read. Along with that, avoid lifting heavy weights, hard work. All those things are making her more weaker during this time. Next. By concluding, I didn't go through all these details, but still I giving a concluding the Rajasulacharya. I am moving on to Garbhini Paricharya. Garbhini means a pregnant lady. So Garbhini Paricharya means the lifestyle modification to be adapted during pregnancy. These are the lifestyle modification to be adapted during the pregnancy. That is, pregnancy means immediately after the conception throughout the gestational period. During this time, a woman's body undergoes a lot of physiological changes along with the psychological changes too. Along with this, she have to provide proper nourishment to the fetus too. So that is why Ayurveda recommended all these care factors for the pregnant women. So physical and mental health of a baby is totally depends on the mother's well-being. So to attain this goal, Ayurveda explained two types of paricharya for a pregnant woman. That is Samanya paricharya, that means general health care, and Masanumasika paricharya, that is month by month care for the pregnant lady and the baby. Next. Next slide. So when it is coming to Samanya Paricharya will be explaining emotions, emotions of the mother and her personal hygiene, dressing, all these will comes under Samanya Paricharya. Emotions like anger, jealous, fear, sadness, sudden shock, all these should be avoided because this can affect a pregnant ladies and her babies' health. And being with always be very pleasant with positive thinking and thinking about well-being of herself and her babies and well-being of others and doing good things for others. All these have an impact on the baby's mental status also, because that is where he learns or she learns all these things in the beginning stage. Being with the Satvika people. Satvika people means, like I said, the above said quality people. If you are being with that kind of people, is equally important, because you know a positive energy can transfer to the people who is along with them. If it is a negative energy, that negative energy can transfer to the people along with them. So always try to be with the positive Satvika, positive energy people will lead to a good mental status of pregnant lady and her baby. Then reading all the praying and worshipping God, whoever they are believing in whatever religion or caste or whatever it is, whomever they are believing, praying to those gods, worshipping, reading that religious or mythological books, and reading other good knowledgeable books. All these things will have a positive impact on baby. Then personal hygiene and dressing, that we have to take it together, because personal hygiene is really important, along with wearing good, tidy, neat and clean dresses is really important and highly recommended, because this way she can stay healthy and she can stay away from the sickness and inflammatory or infectious situations. And wearing light colored dress, light jewelries, all these things are advisable. So from this Samanya Paricharya, I am moving on to Masanumasika Paricharya. Masanumasika means it is the Masanumasika Paricharya is the care described in such a way that it helps the fetus's month by month development and mother's bodily changes. So for example, we can say like in the 4th month, the heart and heartbeat development. 5th month, according to Ayurveda, 5th month, predominantly the growth of mamsa, that flesh and muscles in the muscular tissues development, recta circulation, circulatory system development, and 6th month, bela, varna, hair, nail, bone, all these development. So accordingly, the management changes each month. I'm not giving the each month by month details since the time is very limited. If you want to know all these, you can email us and we will give you a month by month development according to your health condition. And moving on to the diet of a pregnant woman month by month, milk and milk products like butter, buttermilk, ghee, other carbohydrate rich foods and protein rich food and food preparations are administered in are administered in the pregnant ladies. In Masanamasiga Parijarya, they have recommended different types of preparation according to the baby's development and mother's health and nutrition requirement. According to that, they have cited all these preparation month by month basis. Mamsa and Mamsarasa. Mamsa, non-vegetarian food, and Mamsarasa, the meat or meat soup along with prepared along with herbals are also important in these months. Decoctions of different herbs and medicines are advised in each month of pregnancy, especially along with milk or milk products. Example, decoction of bela, manchista, Yeshtimades, licorice, gokshura, drumsticks, etc. are advised in different months. So along with all these internal food, drugs, herbal administration, it is advised application of external application of herbal paste like a sandalwood, red sandalwood, manjista. All these things are advised along. Also, application of processed oil application in the body also advised. All these things application is in a way to get rid of the skin and bodily changes, painful conditions, and during pregnancy the pregnant ladies are getting skin discoloration like melasma, stretch marks, all those things. To avoid all these things, all these kind of applications are also explained in the Masanamasiga Garbhini Parijarya. Month of the Garbhini Parijarya will be mainly aimed to the delivery preparation of the lady. So it is advised certain medicated vasti. Vasti means enemas and vaginal tampons be used to soften the birth canal and normal delivery. Next slide. All these advice, Ayurveda have advised certain don'ts also during the pregnancy time, because that may harm the baby, that may harm the pregnant and pregnancy. So by knowing all these things, we can avoid all those harmful situations. Can you please go back to the previous slide? Okay. So in the don'ts, it is included traveling in uneven roads and long distance, intercourse, smoking, drugs, sedatives, alcohols, etc. Sleeping in supine position, because while sleeping in supine position, there may be a chance of the umbilical cord can wrap around the neck, and that can harm to the baby. And heavy tishna ukshna food, because especially during the youth, during the pregnancy and the menstrual period, I told you, even in the youthful age, there is three doshas are in the body, and pitta will be more predominant these times. So when you are taking tishna, ushna food, all these things, it can alter the pitta in the body, and it can go away from the equilibrium, and so that because of the pitta aggravation, it may lead to the miscarriage or abortion situation it may lead. That's why it is advising to avoid heavy tishna ushna food. And then holding natural urges also not good for a pregnant lady. Then excessive exercise, taking too much certain tastes like sweet, sour, salty, pungent, bitter tastes are also not good for the pregnant women's Next slide, please. So from the Garbhini Parichirya, we are moving on to the Sutika Parichirya. Sutika means the postnatal phase. It usually ranges from 6 weeks to 6 months according to different acharyas. So this is the diet and regimen which we have to follow after the delivery. So in these all these Sutika Parichirya is intended to replenish all dhadus to overcome the loss of nourishment. This helps her to prevent sepsis and other disease and promotes health and proper lactation. Acharya have explained certain therapies like Abhyanga, Avagaha, Snana, etc. for the Sutika. Abhyanga means the massage, body massage. Abhyanga with processed oil, grida, etc. are advised because this helps to tones up the muscles of pelvic floor, abdominal and back muscles and reduce the pain and spasm. It soothes the nervous and endocrine system, releases endorphin. You all know endorphin is the feel-good hormone in our body. So it enhances the release of endorphin, which in terms improves both physical and mental well-being. Thus, it will help to reduce the stress during the puerperium. Even yoni abhyanga, that means vaginal oleation, will help a lot for the Sutika because which tones up the vagina and perineum and prevent laxity and prolapse and alleviates pain and swelling of the vagina. So when it is coming to Avagaha Snana, Avagaha means dipping herself in a tub or basin of warm decoction, which is made up of mainly Vadahara and Pitta. So after the Abhyanga, when she is dipping herself to the Vadahara drug filled in a tub, this will help alleviate the painful condition and inflammation and thus cure any other injuries or wounds that also get cured by the Avagaha because these medicine possess anti-inflammatory, antiseptic properties also. So this can speed up her cure from the delivery wounds and injuries. Then after that, taking a hot water bath also. This also will help her to relax from physical and mental stress. Then coming to Udaraveshtana. Udaraveshtana means wrapping or tying up of long, broad cloth around the abdomen. Abdomen, usually we will use cotton or satin cloth to wrap around the abdomen. This will help her firm up the loosened abdominal muscle and keep the tender bone and pelvic joints, which is expanded during the delivery, to hold these joints in their own position and firm up. These Udaraveshtana will help them and help her to not the vada to accumulate in her abdominal area too. When it is coming to the diet should be introduced in such a way that it improves her Jadarakni means digestive fire. So it should be, the diet should be already, her acne is altered during the previous previous time, like pregnancy and delivery, then delivery soreness, all those things. So her Jadarakni or digestive fire will be altered. So if you introduce a sudden heavy food or heavy diet, or that may not help her to improve her digestion and digestive fire. So what we have to do, we have to introduce a diet in such a way that slowly it will improve the altered and weakened digestive fire. So application of Grida, Taila, etc. will be important in this phase, because it will improve the digestion. Adding herbs like shunti means dry ginger, pipali, turmeric, etc. will improve the digestion and provides anti-inflammatory effect on the body. And these herbs also possess antimicrobial, anti-tumorous properties also, that also will help her to stay healthy during after the delivery and during the Sutika phase. So Grida, Taila, etc. along with the medicated soap and neat soap is addressed to nourish and strengthen the body, and also improve her lactation, so that it in that way that will improve the baby's health too. So during the next slide, please. So along with the Masana Masika care, along with the Sudhika care, after the delivery, Acharyas have explained certain don'ts also for the Sudhikas. Like during postnatal period, Sudhikas are advised to avoid factors such as Vyayama. Vyayama means exercise. Maithuna means sexual intercourse. Then Krodha, anger. And Shida Sevana. Shida Sevana means cold and breezy environment. And Shida Ahara, cold food. All these things can alter her vada predominance and pitta, that may lead to the painful and indigestion painful sick conditions. Then moving on to the Artha Virama, that is menopause and its management through Ayurveda. Again, menopause is a big change in a woman's life. Actually, it's a golden phase of a woman's life, because you are moving to a much stable phase. So this phase, you are almost settled. There is no more changes in hormonal drop or anything. So you are entering into a golden, much stable phase. So face it wisely, you will get a most exciting transition and beginning of a radiant period of life. According to Ayurveda, a human's lifespan can be divided into 3 doshas predominantly. So during Balya and Kaumara, it will be Kapha predominance, and Yavana or youth, it will be Pitta predominance, and middle age to old age, it will be Vada predominance. So, when you are entering to your middle age, it is mostly all the other doshas will be altered, and Vada will be a predominance. Vada will be predominant, and it can show its characterism that time. So this phase is different for both men and women. During this phase, a woman faces a drastic change in hormonal levels. The levels of estrogen and progesterone drops, which was responsible for the building up her immunity, stability, nourishment. So drop in all these will affect different areas of her health, predominantly in the bone mass and cardiovascular areas, and other symptoms of menopause too. Next slide, please. So reduction of this, along with all the reduction of pitta and kapha and dominance of vata, if you don't play all these, play well during this time, all these doshas can show their vikruti in this phase and trouble us with the its different different forms of sickness or symptoms. This vata predominance will show its typical characters like a pain, dryness, burning sensation, and pitta predominance. Because of pitta predominance, all these hot flashes, osteoporosis, vaginal dryness, and digestive issues, mood swings, all these can happen in during this artha virama period. Next slide. When it is coming to management, the management of this artha virama and its symptoms, the main goals will be to bring some balance in these three doshas. Like vata will be predominant and pitta will be low, kapha will be low. So to bring a equilibrium in these three doshas will be one of the main goal. Then second thing is ease all these symptoms of menopause, artha virama. Then reduce stress and insomnia, because mainly this stress and insomnia will be high during this period. And then strengthen the Agni, digestive fire. Next slide. So again, when we are we are aiming these goals, a holistic approach will ease the way to these goals. And mainly yoga and pranayama, these can bring this can lighten up the stress and improve your health in many ways. I'm not going to explain too much about yoga and pranayama because our previous scholars and who is coming again in the next sessions also going to give very good explanation in details about all those things. So I'm not going to much details in yoga and pranayama. I'm coming to the next points. This is a time to make peace with your past and feel contented with whatever you have achieved. Yes, of course, when we are during our previous stages, we were in a rush to achieve something and fulfill our responsibilities and feel free, feel good to you have accomplished everything, you have done your job, all those things. And along with all these things, we will be going through too much mental stress and anger, sadness, disappointment. All these things will be there. All these things will be there. So forget about all those things, and whatever you have achieved, feel contented with that. Make plans for the present and future. Follow a healthy diet, as I said in the previous session. Follow a healthy diet, meaningful exercises, and rasayana therapies, rasayana nourishment in a healthy way using herbs and supplements. Rasayana, its nourishment means rasayana in terms nourish the body in such a way that we can replenish it by bringing it back to its previous healthy state. We can do it with the proper medication and other nourishing supplements, even taking some vitamin supplements, all the iron supplement, all these will come under rasayana. Next slide. So along with that, you can go for some panchakarma therapies, massage, and all the other therapies. This will come under Shodhana and Shamana therapies. Shamana therapies, whatever symptoms and whatever troubles you have, you can consult to a doctor and take along the Shodhana. You can follow a proper Shamana Aushadas according to your conditions, bodily needs. It will help you to stay on track. But always keep in mind, take Aushadas and Panchakarma therapies with an advice of with the advice of your physician. Can you please go to next slide? After all these things, I am moving on to the next session of our discussion. It is PCOD or PCOS and Ayurveda. So now I will, I will move on to the topic which is most common in the women of all age group. When we in the practice current in our practice, we can see there will not be a age limitation for this situation. We can see it's in small girls, like if they attain puberty recently and they are going through, or when they are going through their that fruitful age like 20s or 30s, even in multiparous women after their delivery also we can see this PCOD or PCOS condition. PCOS is, it's not a single disease, it's a condition with many presentation. We can say it is a group of symptoms. So PCOS is mainly a combination of anovulation. There is no ovulation happening properly, along with the hyperandrogenism. Hyperandrogen is male hormone that might be predominant in this condition, PCOD or PCOS condition. So finally, that is why it is calling us PCOS, because when it is PCOD, it will be just a condition developed by the imbalance of hormone. But when it is moving to the PCOS later on, it will move on to it will move on to a disorder of endocrine system and a metabolic condition. So PCOS is mainly a combination of anovulation and hyperandrogenism. Can you please move on to the previous slide? So previous slide. So this metabolic disorder, we can see 5 to 8% of general population affected. And in this 5 to 8% itself, out of these 40% is with infertility. I'm not going much with infertility because the previous Dr. Dashani have given a beautiful explanation of how this infertility in the PCOS condition. So we will move to next session. Next slide. So when PCOD comes, it will be common presentation will be like weight gain, acne, pigmentation, infertility, weight gain, acne, pigmentation, hair growth and hair loss also can be visible. This hair growth and hair loss, if you see, it will be in a masculine pattern, like hair loss will be, balding will be happening in the frontal area of the head, and hair growth will be happening on the face, chest, all those things. All these are showing a androgen effect. And menstrual irregularities. Menstrual irregularities we can see in two ways, mainly. Some may have amenorrhea, that is absence of menstruation. Some may have menorrhagia, that will be like too much bleeding. So the menstrual irregularities. Then it is infertility. When it is coming to infertility, it will be very difficult to attain pregnancy. Pregnancy, either very difficult or it will take a long time, or finally the couple may move to other artificial insemination, all these things because of all these PCOD conditions. Next slide. Next slide. So when we see these situations, we can see there are two types of people. Mainly we can see it is obese PCOD and lean PCOD. Obese PCOD is mainly we can correlate like our we can there will be weight gain, and there will be insulin intolerance also we can see in them, and their metabolic function will be very low. All these things will come to obese PCOD. Then but when it is lean PCOD, the patient will not gain much weight, but they will have all the PCOD symptoms like this hirsutism, and baldness, menstrual irregularities, all those things we can see in the lean patients. Next slide. So when it is coming to Ayurvedic way, the same kind of lakshanas are explained in Ayurveda too. In this PCOS or PCOD condition, there will not be an explanation of a typical, there will not be an explanation of typical gynecological disease in these, but there will be a group of all these symptoms which is related to all the menstrual irregularities we can see. So the lakshanas they have explained is staulya. Staulya means obesity. Granthi means cystic or other growth in the ovary or uterus. And Chudra Roga. Chudra Roga means all the skin conditions like pigmentation, acne, then irritation, itching kind of itching small pustules, all these kind of skin conditions we can see. Then kalitya, palitya, all these things are like hair loss and baldness, all those things. Then artava and yoni vyapat. Artava means menstrual irregularities, and yoni means vaginal symptoms also we can see in the PCOS or PCOD condition when we refer it to the Ayurvedic way also. Next slide. Then Nidana. Nidana means the cause of all these things. Even in Ayurveda, it is saying Jivda Shaili Roga. So Jivda Shaili means it's altered lifestyle and altered lifestyle, altered habits, altered sleep, and stress, exposure to extrinsic hormones, genetic tendencies, all these are explained in the Nidana. So daily work hours, or if it is a student, study hours, sleep pattern, food pattern, altered exercise pattern, by all these we can alter your biological clock, and which leads to bodily changes, which finally result in the PCOD or PCOS condition. Next slide. So Ayurveda have grouped all these sickness into three groups. It is first group is sahaja. Sahaja means there will be bija dosha. Bija means the egg will not be pure. That can come under genetic condition, bija doshas. And second category is aharaja. Aharaja is because of wrong food habits, which is explained in very detail in Ayurveda, like a wrong food, like adhyashana. Adhyashana means eating too much, and vishamashana, eating heavy food, and vidahyashana, indigestion. Indigestion means it is very difficult to digest, so the food will be left over in the stomach for a long time than the normal digestion time. Then taking too much sweet, too much oily food, and there is an important in viruddha ahara. Viruddha ahara means the wrong combination of food, like sometimes two kind of food or food items we cannot join together and take it. But many in the current situation, all these junk food and all those things, if you see, you can mainly see whatever they have explained in this viruddha ahara. This is we can see in the practice. Like for example, I can say malsya, fish and yogurt together. That is highly not recommended viruddha ahara, fish and yogurt together. Same way, we can say eating very cold food or hot food, immediately you are going for a very cold, ice cold drink. All these things will comes under aharaja vyadhi. So Then the third category will come into vihara. Vihara means our wrong deeds, like abhyayama, without doing any exercise, staying in a place for a long time without doing any exercise. And then divasapna, divasapna and ratri jagarana. Ratri jagarana, these things, sleeping in the daytime and not sleeping, staying very late in the night hours, all these things will come under viharaja vyadhis. So when it is coming to the management, or that is when the importance of what I have explained, previously explained, dinacharya, ritucharya, ritumadicharya, and rajasalacharya, all these importance of all these things will comes when it is coming to the PCOD management. Can you please move on to the next slide? Okay, since it is a disorder of different symptoms and involvement, the treatment pattern will be different in different people. So we are, when all these pattern, we are like dinacharya, ritucharya, ritumadicharya, all we have explained already in the previous session. That is why I have explained all those things in detail before coming to the PCOD and PCOS. So we have explained all those things there. We are coming directly to the Vyayama. Vyayama means whatever meaningful exercise you are doing will comes under Vyayama. Then yoga, dance, and all other activities, physical activities done will come under the Vyayama, which is exercise. So jogging, walking, aerobics, different forms of dance, athletics, even when kids are doing, they are doing the skipping games, all these we can consider as Vyayamas. So doing all these things in a meaningful way means at least you have to do it in 30 to 40 minutes a day, weekly, 5 days a week. And you should do it in a way like your body should, your body's muscle should work hard, and you will get sweating from that. That is what the meaningful way when you are doing it. So all these things, Vyayama, all these ways of Vyayamas will help you stay healthy and control the PCOD conditions. Next slide. Then when it is coming to Ahara. Ahara, remember what are quality food we have explained in the previous sessions. We have to follow all these in the PCOD management also, because it is not a disease to control with only medication. It is a lifestyle disease which is coming with Aharaja, Viharaja, Vyadhi. So Ahara also have an important role in this situation. When it is coming to a healthy plate, we cannot define a healthy plate one fit to all, because people are living in different socio-economic condition. So it is a physician's, when it is coming to a healthy plate, it is a physician's responsibility to consider that patient's socio-economic condition and how they live, what is their availability of food, all those things. Considering all those things, a physician should define a healthy plate for them and guide them through that. Then I have given a generalized example of a healthy plate, which consists of half, almost 1/4 part of the plate is with the grains, 1/4 part is proteins, and 1/3 part is with the fruits, and 1/3 part is with the veggies. So in these proteins or grains or veggies or fruits, whatever, one more thing it is important is whatever is available seasonally, we have to choose. If mango is available in that season, mango is good. Than is an off-season fruit or vegetable which is exported, or whatever is available in your desha, which is when it is coming to this, we will explain it is like a desha kala. Consider desha, what desha you are living and whatever growing in that desha, and kala, whatever season it is, and whatever vegetables or fruits or whatever is easily available and growing in that season. That consider that kala, desha, all those things, and your body's health condition. Consider all these things and define a healthy plate for your patient or for yourself. Then when you drinking water, drinking plenty of water is much important when it is coming to your proper metabolic activities in your body. So then avoid junk food, timely, then taking meals, take timely small meals. That will help, that also will help you to stay healthy and provide a constant uh, uh, nutrition supplement than a bunch of food or carbohydrate or whatever it is, supplying all this in a big quantity. Instead of that, you have to supply it in a timely small intervals and in different times than 3 times a day taking heavy food. Then avoid food and food habit causing santarpana. Santarpana means nourishing your body too much, that will lead to obesity, all these insulin intolerance, all these things. Even prameha also we can consider under the PCOD, this insulin and glucose level, high glucose level, glucose intolerance in the body. That is why when it is coming to the modern medicine, like a doctor, our previous doctor said, they are supplying metformin to bring it to the normalcy. So avoid that kind of condition when it is coming to ahara. Next slide. Same way, nidra. Nidra means the sleep pattern. Sleeping during daytime and sleeping Ratri Jagarana, staying awake in the night time, spending too much time in front of all these gadgets, all these things, because of the nowadays the couples, like even husband and wife, both will be working and they'll be spending too much time in front of all these laptops or computer, and their work hours will be different. So they will be sitting late night, and when they are going, and the overuse of all this mobile, all those things will alter our sleep pattern. So always try to maintain proper sleep pattern, sleeping 8 hours in the night, not 8 hours in any time. So this is when it is coming, all these sleep pattern, everything I have explained earlier, so I'm not going much details into this. Next slide. Then Chigilsa also, along with all these, remember we have explained already. It is very important. It is not a disease to treat only with medicine. It is a lifestyle disease which is developed because of our lifestyle. So treatment with medicine alone will not be working in the situation of PCOD. So lifestyle modification, sleep modification, along with the Shamana Chikitsa, the medication, application of medication, all these things will work together only in the when it is coming to PCOD management. So Shamana Chikitsa will be depend on the patient's condition situation, which will be Agni Deepana, that like improve the digestive Pitta Vardhaga, Strodho Shodhaga, all these things we will be using for the treatment of Shamana medicine. Shamana medicine, it will be curing the symptoms of the disease. Then when it is coming to Shodhana Chikitsa, Shodhana, it will comes under Panchakarma. So mainly we will not do all these Panchakarmas, but we'll be going to Rukshana, Swedana, Snehana. Rukshana means if it is Kapha Dosha predominance, we will try to balance the Kapha Dosha with using some Rukshana therapy. Then we will do some snehana. Snehana means oil application in the body externally and internally. We will bring up the vitiated dosha to our body, and then we will do the svedana. Svedana means steam therapy. That sometimes it will be a steam chamber, or sometimes we'll use other methods to make the person sweat and expel all the toxins through the sweat. Then we will use Vamana therapy, which usually mainly we will use in the upper digestive part, like a stomach and above part, where to clean and expel the toxins away from the body. We will use the Vamana, and when it is coming to lower digestive part, we will do Virejana, then Nasyam. Nasyam also will be working because, like the previous doctor said, there will be HPO axis involvement will be there. So in inducing the brain and hypothalamus and pituitary glands to work properly, so that the hormone release, LH and FSH release will be normal. That will induce the ovary to release estrogen and progesterone properly. That will finally end up in the proper ovulation, and it will end up in the menstruation. So Nasyam also will work a major role, and Vasti also. Vasti also, the medicated oil or ghee or medicated kashayas we will use in the form of Vasti, that is enemas to expel all the toxins and the toxic effect of this hormonal imbalance out of the body, and purify your body, so that all these things work together to manage the PCOD in the Ayurveda. Next slide. So in this stage, treatment and all this lifestyle modification, I have explained in a briefly, and if you wants to know more about all these points which I have explained, you can contact the coordinators and they can mail me, or you can consult your Ayurvedic doctors, and you can follow a proper diet and lifestyle management and treatment pattern, which will be fit to your body. Always keep in mind, one doesn't fits all, because different bodies need different kind of care and treatment. So always consult a doctor and go through all these kind of lifestyle modification treatment therapies and finally you will be able to control your PCOD and PCOS. Thank you for giving me this opportunity to discuss with all these things in this platform. I hope you all enjoyed this session. Thank you very much.
Thank you, ma'am, for your wonderful session. We know it's midnight for you, but thank you so much. Thank you.
That's okay. Thank you.
So our next chief guest of the day is Dr. S. Selvalakshmi, ma'am, who is most well-known personality. So we no need to give introduction on her, but still I'll give that. And so Dr. S. Selvalakshmi, ma'am, who is working as an assistant professor in Tamil Nadu Physical Education and Sports University, Department of Yoga, and holding the additional charge as the HOD. And she has guided more than 300 students, and she has received more awards, especially the Yoga Muller, Yoga Charini, Yoga Sironmani, Yoga Chemal, Yoga Samrat, Yoga Ratna, and so many. and she is the Vice President of Tamil Nadu Women Yoga Association, Chennai. And she has published more than 3 books, and she has published more than 30 articles, international and national journals. And she has presented 18 research papers in national and international conferences. And she had given speech in DD Podige TV on the topic Magalir Yoga, and had given speech in Channel 24 YouTube channel on yoga. And she's such a wonderful, famous personality. Welcome you, ma'am. Over the session to you.
Ma'am, can you please unmute yourself? Ma'am, voice is not audible yet now. Ma'am, it is very low now. It is very low. Illa, ma'am. Still, it is very low.
I'm coming in the system.
Yes, ma'am. Yes, ma'am. Now it is perfect. Ma'am, first it was very perfect, ma'am.
Now, can you hear
Yes,
me?
ma'am. Yes, ma'am. Now
Yes.
it is perfect.
Yes, okay. Then
You can share the slide also, ma'am.
yeah, thank you. Yeah, can you see the slide now?
Not yet, ma'am. Please give share screen and then proceed on.
Yeah, am I? Oh, 1 second. I'm not. Okay, 1 second. 1 second. One second. I'll share the screen now.
Okay.
Yeah, can you view the screen now?
Yes, ma'am. Yes, ma'am. Just make a full visible screen for your file. Okay.
Is it okay now?
Yes, ma'am. Perfect. We'll proceed,
Yeah.
ma'am.
Yeah, is it audible? Can I?
Both are fine, ma'am. Audio and video both are fine. We can proceed, ma'am.
Thank you, Elil, and thank you, Nalini, for giving me giving a nice introduction about me. First of all, I would like to show my gratitude to the MAGER Institute, which gave me the opportunity, though it is from Yogalaya of Elil. It is a great honor for me that the mentor and the person whose footpath I'm following, Dr. Ilangovan sir, he's great enough to accept me as the resource person of the day. So I would like to show my gratitude, and with this, since we are running short of time, I would like to start the session. Ellam valla iraiva potri. So I take this opportunity to present my session with the blessings of the great sages. One is from the extreme north and the one is from the extreme south. You can see over here, they are the gurus of yoga, we called, and they are the fathers. I take Guru Tirumular also as father of yoga because many of us were not aware of it. With their blessings, I'll just continue that session now. So the topic which I have chosen is yoga, a boon for wow. The word wow we can use for many things. Generally, whatever the thing which makes us feel so happy, excited, whatever it may be, there we will be using this word wow. Let this vow can be like this: well-being of women. Let us take this vow for well-being of women. Only if women are so good, when the wellness of the women are taken care, the entire family is to be taken care by them, and it is going to be a wow family then. So how this well-being of women can be through yoga is the presentation today. So we see, and we have to accept that the hand that rocks the cradle is the hand that rules the world. It is not me who says this. It is an eminent person, W.R. Wallace. He has greatly said that the hand that rocks the cradle is the hand that rules the world. And see, of course, before getting into what are all the disorders or the diseases or the problems of women, let us have a few things about the goodness of women or the greatness of women. We should know the importance of women. Like, see, they are the mother of human race. They are the gift of God. And without them, it seems to be a darkness in the society. So no creation of man is possible without women. So this is what nature says, that women is a gift. And see, in tradition, in yoga tradition also, women were given much more importance. In Sankhya Yoga, women is compared with Prakriti, which is called as nature. And like nature, why it is compared with nature? It means she remains ever active. Nowhere you can see, even this COVID-19 period, many of the men, they were having the option of working from home, and the teachers can take rest at home. The other faculties, whatever their job is being given permission or option to do like this, like that. But what happens to a homemaker? A teacher is a homemaker, a lawyer is a homemaker. No, we are coming to the role again. Whatever the role has been given a exemption, whereas the role of women homemaker, it is not given rest. So she remains active ever. And that is why Kalidas, he describes women as a spark of life. So this means this spark, it is going to uplift the society anywhere at everywhere. And see, we have to see the role of women, multiple roles. The slide, it shows what are all the role of women. So having these many over their head, they have to act according to their role, which is played at different places. At home, a mother, a wife, a daughter, a daughter-in-law, no, sister-in-law, whatever it may be. In school, a teacher. In outside, a friend. No, many roles she has to play. Above all, nature has given another responsibility also, the motherhood, which is the speciality of women. No others can have it, and this alone differentiates the women from rest of the other beings. Okay, so the wealth of the nation or the health of the generation, whatever it may be, everything at the whole, it depends upon the mental and physical well-being of a woman. You take it for a minute and think over, if a mother or a wife at home, if she gets some disturbance, either mentally or physically, what will be the next few days, until she recovers? This is what we have to understand, being a woman. And of course, most of the participants here, I think, would be women. And if men happens to be inside, they have to think over what is the role of women then. See, women are mentally and physically sound. If you think, if you accept, only if the women are mentally and physically sound, their offsprings are going to have this sturdy constitution. Unless otherwise, it is not possible. And then see, now we are stepping into the next thing. We have seen all the importance and the speciality of women, whereas they too are the living being made with bone and bone, nerve, blood, and etc., all these anatomical and physiological structure. So they too were stretched and stressed. They are not being of, no, they are not made out of any metals. So they are made of the soft tissues, so they are also stretched and stressed. While they look after everyone around them, we have to seek a thing to look after those good nature, good hearted women also. So who is that? Who is going to take care of these kind of dedicated species in the world? Women's health, of course, it has to be taken care. And you find the answer for this question. Who is going to take care of women at anyhow? So I'm giving you the answer. It is yoga, and yoga itself, it says, I will change your life. Let being the sisters, you may be elder to me, you may be younger to me, you may be in the no in my daughter's age, whoever it may be, my dear friends and all sisters, please take care. Yoga is the one which is going to change your life. So yoga, the way which going to balance the today's beauty with brains. Who are the beauties with brains? It is nobody else, it is we the women are beauty with brains. So we need the balance. That balance of today is going to be given by yoga. So one women, those who want to be holistically health, that means to have a complete health, we need all these, one those who are very well aware of the definition for health, which is given by World Health Organization. You will be knowing it is a state of complete physical, mental, social and emotional well-being. For that reason, I have given you, see, you have to be physically stable, right? Physically stable. Mentally, there should be clarity. No, always there should not be any conflicts within you. You should be very clear in your ideas, in your thoughts, in your decisions, whatever it may be. So mental clarity is most important. And the emotional balance, this can happen only when you take up every emotion in the same way. Like மிகினும் குறையினும் தீது செய்யும். எதுவுமே வந்து அதிகமானாலும் கம்மியானாலும் நமக்கு பிரச்சனை தான். Whatever it may be, it may be food, it may be love, affection, whatever it may be, when it goes beyond, when it is less than the expectation, it is going to be a problem again. So there should be a problem. You should not be so happy to one extent, and you should not get into trouble on the other extent. So you have to be emotionally balanced. So take all these positive emotions as well as the negative emotions in the right sense and the balanced way. And the next one is social health, where if you are not socially fit, you are unfit to say that you are a human being, because you are a social animal. Including me, we are a social animal. We are dwelling in the society where we are surrounded by the fellow human beings. So we have to have the social awareness and we have to be socially fit. Then afterwards, it is said that the individual, whoever it may be men or women, all are said to be having a complete health or a holistic health only if you have this physical stability, mental clarity, emotional balance and social awareness. And you should not forget about the one much more important thing, that is called as spiritual health. Don't take it in a wrong sense that spiritual health in the sense madam is advising to go for a temple or whatever, no, wherever you feel like and praying to God. It is not. I'm not getting into that spiritual area. We are talking about loving the nature, taking the other living being as a living being and giving service to them. ஜீவ காருண்யம் சொல்லுவோமா, எல்லா உயிரையும் நம்மள மாதிரி. So giving respect to all the living creatures, that itself is a great spiritual strength and maturity. So that is most important. So spiritually you should be very strong. So these are the requirements for good health and the complete health. So this can be obtained through yoga, that you are all well aware of. And then where is the difference between the other living being and the other gender and women? Here comes one special health along with this holistic health. One more which is exclusive for women is the menstrual health, where mostly all the women, they are not taking it very seriously, and the later stage they are dwelling into a greater problems or bigger problems, like many issues are there. So it has a simple term like menstrual disorder, menstrual health issues. It has lot within, where we need much more awareness on it. So when it comes to yoga for women, one named Lon Bizedin, he says that it has importance in all phases of women's life. You cannot say that yoga is at the age of 10, yoga is at the age of 50, or at the age of 90. It is not like that. Every age, every phases of the human being, exclusively for women, right from the birth. After that, you can see the stages it goes, like infant, and then childhood, middle childhood, later childhood. It goes on like that. So in all phases of the women's life, it is going to be a helpful one. So what happens actually is, the body, it is going to release a chemical. All since we all are in the same field, and I think very few will be new to this particular webinar. Since all are from the yoga fraternity, we will be knowing what actually happens. So it releases the chemicals, in terms it is the hormones, into the bloodstream, that brings a sense of well-being and contentment. Now we might be wondering when, how, and why to do yoga. And see, you can see it is going to be a blessing for women in the beginning age, and it is going to be in all, in the previous slide we see in all phases. So productive period, transitional period, and the women's golden years, where we are working and we are earning, that is where that is the golden years. And the lifetime companion, even at the menopause, after menopause, in the sedentary life, when it becomes at the age of 70, 80, that time also yoga is going to be a boon for us. And next, coming to the problems of women, no, it is a statistics which says that you can see a few countries: Afghanistan, Congo, China, China is missing, India, Pakistan, Somalia. These are the 5 countries. So it is a statistics which reveals that among the 5 countries, India is one among them that are dangerous for women in the issues of health, discrimination, cultural, sexual violence, and trafficking. See, when it comes to all these areas, we are exclusively going to take this health alone. We are not going for this next 4. We are going to have this health issue alone. Coming to the health issue, we are taking up only the menstrual health now. And see, before getting into the menstrual disorders or menstrual issues, just we will have a recap over what is called as menstruation. We know at the age of 12 to 13, don't compare with today's age, my dear fellow sisters and friends. Today, at the age of 6 and 7 and 8, the child is getting matured enough. It is the lifestyle which has been so bad, and creating a a threatening lifestyle now. So the onset of menstruation is, earlier it was 15, 16, and even at the age of 18 also. In olden days I'm talking about. Now the commonly accepted age is 12 to 13 years, where it is called as menarche, and a monthly cycle. Generally, why I am so specific about this slide is, only after knowing this we will be knowing what kind of problem we are facing. So a monthly cycle, after attaining the menstruation, that is the menarche. Once the child is after getting into the menarche stage, see, every month the cycle has to be there. That is the monthly period, or the menstruation has to last at the average of 28 days. That is the cycle, once in 28 days. And all these things, many doctors have, I think yesterday and today also, the Ayurveda doctor would have told. I don't know, I'm not aware of it. And now you can see, generally it is about 21 to 35 days it is considered normal, whereas the period should be lasting up to 3 to 5 days, and it can be less than 3 also, and more than 5 also, that is 2 to 7 days. When it comes to absence of menstruation, there are possibilities and there are accepted situations where the absence of menstruation can happen is only during the pregnancy, during the breastfeed, after the delivery, during the breastfeed, and then perimenopause. That is the period of transition to menopause. So in this period, there is an absence of menstruation. Without these conditions, if there is any absence, then it is called as one of the menstrual disorder. Now we can see the menstrual disorders. I think I'm going little fast. Since these informations are very older one and it is very common, I'm just moving on the slides. When it comes to the yogic management, I'll go little slow. So the conditions are amenorrhea, dysmenorrhea, menorrhagia, tetrarrhea, oligomenorrhea, hypomenorrhea, and polymenorrhea. These disorders, it describes about the previous slide. See here we saw about the length of the cycle, the duration of the periods, and the absence of menstruation. If any changes happens in these three, either in the length, either in the duration, either in the presence or absence of menstruation, and one more is the flow of blood, whether it is in the slow, whether it is low or high. Based on this, these kind of menstrual disorders we are concentrating on. Amenorrhea is the absence. Dysmenorrhea is the pain in the most of the teenagers facing the problem is dysmenorrhea, that is the painful symptom. And then menorrhagia, heavy bleeding for prolonged period. So it is heavy, as well as the prolonged, it goes beyond 7 days and more than that. And metrorrhagia, here it is like irregular intervals, not like once in 28, once in 15 days, sometimes once in 35 days or 40 days above. There is no regularity in between. So the another one is oligomenorrhea. It is going to be a light or infrequent menstruation, and also it goes beyond 35 days also. And hypomenorrhea, it is less, so it is a short or scanty period. And polymenorrhea is the abnormal bleeding, so less than 21 days, 20 days, even 15 days you might be experiencing. A very few women might be experiencing. So this is what polymenorrhea. And these are the other problems where women are facing exclusive women issues. We are not talking about the general health, it is exclusive women health, we can see. And then coming to yogic management now. See, a report says that majority of doctors believe that only women participate in strenuous activity at home time, but they actually benefit from it. So it is said that in earlier days, in olden days, we were made to sit idle, because we may have the physiological changes and psychological changes during the menstruation. At the time we will be having some kind of changes, because of which we may prone to some psychological discomfort. Now also you might be feeling, your mother or your sister, you might be seeing the changes during the menstrual period. They will get some wild, they'll be shouting, unnecessarily, they will be shouting, they'll be angry. All these are because of this menstrual, it is not disorder, menstrual period, at that time. In order to make the women feel comfortable and to take rest, in order to make them take rest, it was in the name of God, they were asked to be aside of the home. Now also in villages, in hamlets, you can see people are having or following this system of sitting outside the home and having the entire 3 days having a separate lifestyle. Now it is said that when you participate in the strenuous activity, you are going to get benefit out of it, not only it is not going to harm you in any sense. So in 1965 one study was compared, that is to make you understand. I have taken this study. So women swimmers and the others, those who are not the athletes, they were compared. And you see, the swimmers have less menstrual difficulty. That means they are very active, they are working out, so their menstrual difficulty is less when compared to the non-athletes or the those who are not participating in any strenuous activities. Similarly, the underlying emotional and hormonal, that is most important. you might be very well aware of. See, when you are put under a condition where you are more emotional, out of which the hormone imbalance is possible, and you might be seeing the cycle once in 28 days. That may prepone to 21 days, or even before that. You may be expecting, you may be knowing at what date your menstruation is going to happen, but it happens prior to that. And the reason also, you will be knowing that you have been stressed for the previous 1 week, or some kind of tensed work, or some kind of problem. No, that in turn it imbalances your hormone, and that means imbalance is either low or it is high. So this imbalance, it is going to induce the no menstruation at the early days. So this underlying emotional and hormonal imbalance, it is going to readily rectified by simple and regular yogic practices. Now we will move on to what are all the yogic practices which is going to help get rid of this menstrual disorders, or this menstrual, no, improving the menstrual health, and how it is going to work. Now, you all know what is meant by yoga, what is meant by asanas, and how to do all those things. Since the time is very limited, I have taken up and I'm just giving you an eye opener. What are all the possibilities of techniques are there in yoga practices? So when you practice Surya Namaskar, it will increase the pranic energy and the balance of nerves and endocrine functions. That is most important. So it can be done according to your capacity, and you have to develop it to the more rounds. I know during the period, we are not talking about during the menstruation. All is a continuous practice, and yogic practices to be continuous all round. So you can do Surya Namaskar, start developing Surya Namaskar. That will in turn help you to increase your pranic energy, and it is going to break the blocks in between, and it is going to help you to balance the nervous and endocrine functions. So slowly we can improve, and it can be done over a period. When you are not able to do at the time of my monthly cycle, that never that doesn't matter. It has to be regularly done prior to the other one. So coming to asanas, all these I have taken the reference from Bigha School of Yoga and Iyengar School of Yoga, and many more texts have been compared and it has been given. So what happens when these asanas are done? No, we have to learn the science and the technique behind doing. Simply suggesting asana is not enough. What actually happens, we have to know. So what is the, which is the area and what is the role during the menstruation is, it is in the pelvic area, and the role is the hormone, the role of hormone, estrogen, progesterone, and many hormones are there. When it starts secreting more, and when it comes reducing, all these are the science behind it, and we are not going to have the endocrine signs now. See, these kind of asanas, all you can see, it is going to work on somewhere or the other on the pelvic area, and sometimes on your whole body, and sometimes it is when it comes to the thyroid and other things, somewhere it is going to work on the Vishuddhi chakra. Why? Because all these are directly associated with the abdomen and the pelvic area, and sometimes it is associated with the thyroid also, which is associated with your menstrual issues. So this Shakti Bandha series is most effective in releasing the blockages of energy in the pelvic region. Now you can see Siddha Yoniasana, Ustrasana, Marjariasana, and the names, it goes on like this: Sashangasana, Sukta Vajrasana. Sorry, it is a spelling mistake over there. Sukta Vajrasana and Sashank Bhujangasan, Salabasan. All these asanas are going to help the women community to come out from their menstrual irregularities and menstrual issues. And then you can see many other asanas also, it has been given. These are the asanas which is going to help mostly for issues as well as to have the regular menstruations, and otherwise if you don't have anything, then to have the right or the proper menstruation to continue in future also, this is going to help you. And when it comes to inverted asanas, we know that what happens during the menstruation. So this inverted asanas are not advised during the menstruation, because to avoid the backflow or the it is there is a possibility of redirecting the flow of the impure blood back again into the body or the system. So it is particularly recommended at the it is prior to that, this is recommended, no, not during the menstruation, prior to your menstruation and after your menstruation, these inverted asanas are recommended. And so it is recommended because they can promote the drainage of the reproductive organs and enhance purity and pituitary blood flow. That is why it is advised, and it should be avoided on the days of menstrual flow. That is what. And this is why it is said that generally there is a wrong notion that yogic practices should not be done during the menstrual cycle. It is not like that, my dear friends and sisters. It is only the uh, inverted asanas and like kapalpadi, like the one which gives you more strain. The strenuous activities are not advised during the menstrual cycle. Rather, you can do all the simple yogic practices, excluding inverted asanas. When it comes to pranayama, see all these balancing pranayamas, Nadi Shodhana, Ujjayi, and Brahmari. You may be wondering how it is going to work. See, these are all the associated symptoms of menstruation, like headache, migraine, mental tension, many things, and toxins are there inside the body. Stress will be there, and I told you, because of this menstrual irregularities, thyroid, obesity, many problems are associated problems. When it comes to pranayama, these associated problems can be addressed with, and this can be eliminated, or this can be taken care of, this can be managed, and this is because of pranayama practice. See, the balancing pranayama like Nadi Shodhana, Ujjayi, Brahmari, they are very effective for those who are prone to headache, migraine, and mental tensions generally. And the tensions, generally the psychic tensions and mental irritability, as I told you, during the time of menstruation, unknowingly this mental tension and irritation, it happens, it is because of the say the hormonal changes. It is not nothing else, it is the hormonal changes. And we know there are mood hormones, many hormones are there, having good hormone and love hormone, many hormones are there, having different names over it. And you see this particular changes in the hormones, they are reason for the associated problems, and pranayama can help removing these issues. And then Bastrika, that is the energizing pranayama, it enhances the vitality and it helps in eliminating the toxins. See, nowhere it should be according to your ability. According to your ability, it should not be it should not be done beyond your limits. And this Bastika, it is recommended if there is amenorrhea and dysmenorrhea. So that is, it will be helping you. And then you see, Anlom Vilom, again the normal breathe in and breathe out. The stress level can be reduced and it can help in cooling the body. See, this Kapalpadi, it helps in the associated problems which can be done no, after the menstrual period or before the menstrual periods, which helps in regulating the thyroid, obesity, and the digestive issues. So all these factors, why I'm focusing on all these different factors are, these factors, one or the other way, singularly, single or in a multiple, can work together to cause the irregular periods. So you have to understand these factors all, and one or the other way, in single or collectively, it is going to have impact on irregular periods. So this kind of issues has to be taken care by practicing pranayama. And coming to mudras and bandhas, the locks and gestures, it is going to help in menstrual disorders in these ways. You see this mentioned mudras, Viparita Karni, Pashini, Ashwini, Moolavandha, you see all these are going to work on the reproductive area and the reproductive organs. So it generates the vital energy in that particular area. And it can stimulate the pelvic nerves, and it tones the sexual and the eliminative organs. So that is most important. Why? Because if there is any toxins retained, or if there is any muscle tones or nerve tones are not proper, and if your eliminative organs are not functioning properly, and it also is going to be a reason for uh, the menstrual irregularity. So this mudras, it is going to help in toning and helping the eliminative and the sexual organs in a better way. And coming to this Mahamudra and Mahabeda Mudra, it can elevate the premenstrual tension. So we know what is meant by premenstrual tension. Before the that no menstrual period, 2 days before, or even for some it may be 1 week ahead, they will be feeling some sort of this premenstrual tensions, and symptoms also are there. PMS, we call it as premenstrual symptoms also there. Like chest pain and headache. Some might be experiencing fever, for some it might be diarrhea, and lot more symptoms are there. And this two mudras, it is going to help in alleviating the premenstrual tension. So that is one thing. And the one who has the prolapse of uterus, they can have Moolabandha and Ashwini Mudra. This will help in coming out from that prolapsed uterus issues. And see, coming to Kriya, it plays a major role in this irregular menstruation. Why? Because when there is a constipation issue, it is going to influence in a greater way of worsening the pelvic congestion, out of which this dysmenorrhea is a problem. The pain and the cramp is there. So this kind of issues can be rectified, or this can be addressed with Kshatriya. So Neti can be practiced daily, and Kunjal as well as Lagu can be practiced twice a week. You know, uh, according to their requirement, how much they required, it can be done. So you see, constipation, it is the associated factor which worsens the pelvic congestion, and this should be corrected, because the initial step or the primary concern is to relieve the menstrual disorders or leukorrhea or the exclusive dysmenorrhea. This constipation has to be noticed, and this has to be worked upon by Kriya, and then only the associated or the next stage of menstrual disorders can be relieved. And then coming to relaxation, see, the one most important thing is, along with the other thing, Yoga Nidra, it is going to play a vital role, and it is going to be a key relaxating technique in the when you are in the premenstrual time, or premenstrual symptoms or tensions are there prior to the onset of the period. Yoga Nidra, it is going to be an important, we can say, or it is going to be again great remedy for this kind of issues. And it relieves the mental tension, the mood disorder can be rectified, and the depression, heaviness, everything can be get rid of by practicing Yoga Nidra. If you don't have to practice, if you don't have time to practice yoga nidra as a complete technique, you can just go with relaxation in Shavasana and concentration on the abdominal breathing alone. That is more than enough. It was going to work on the menstrual issues. Coming to meditation, Jaba, Ajaba, Jaba, Antar Mauna, it is going to help you a lot during the time of menstruation. That is more enough than the other one. See the diet recommendation, again it is from various gurus and their knowledge has been shared over here. Vegetarian diet and very light diet or fasting with and less oil meat, and red meat is totally has to be avoided, and please avoid red meat during the time, and see this caffeine, coffee, tea and other kind of items, it has to be avoided, and then especially uh, don't take too much stress into your body or into your mind. That will alter your menstrual periods, either loss of or over bleeding or prior to or during the time. All these associated things are, it depends upon the bodily and the mindful, mind when it is filled with stress. So avoid stresses during those times. And coming to the other recommendations, be in and fresh air in open area, and then see, you have to have more relaxation, and then all these things is as like other diet recommendations I have told you. And iron enriched, since we are losing a lot of uh, blood away, iron enriched food has to be taken prior to and during the menstrual flow, and then you can take fruit or something. And one exclusive and important thing I would suggest is, please keep yourself warm, don't go into cold weather, and don't expose your feet, especially your feet, into cold with cold water or chilled water often. So keep your body in a warm condition, as well as your feet, especially your feet, in a warm. So that will help you to prevent the pelvic congestion, the tightness or the pelvic congestion. And if possible, just apply heat to the pelvic region to relieve the pain. It is like the hot water bath or hot water thing which we used to give for the other body parts. When you are prone to any injury, the hot and ice pack is given. Similarly here also, you can use the application of heat to the pelvic region also, if you are prone to dysmenorrhea or the general symptoms of pain during the menstrual period. So that is good enough to come out of it. And simply stating from books and other things, you might be not ready to accept. So I'm giving you some of the research findings also, which for your acceptance. See, a study conducted in the Boston University, they demonstrated that yoga, it improved the mood and anxiety level, for those women. The anxiety and mood disorders have been improved because of yoga practices. So it is proved that this GABA activity tends to be lower in the people in anxiety and mood disorders. When yoga is practiced, this level is increased. In turn, the mood disorders, we used to call the mood disorders, it has been taken care of, and it improves the mood and anxiety, those who are lacking in this. So it is one study conducted in 2010. And you see, the restorative agent in cancer, sometimes here, which is associated with women, not alone menstrual issues, other variables also been stated. I have given you the collective studies, so that how yoga is helping women for various factors. So you can see, Wake Forest University School of Medicine has recommended yoga in their pilot study. That means the ovarian and breast cancer, women with ovarian and breast cancer women, they have been taken as the subjects, and they have found that in the result, no significant improvements were seen for depression, negative effects, state anxiety, mental health, all over quality. So you see, those who are affected with the cancer, generally you can imagine how much issues they might be facing, what are all the changes they might have gone through. And due to yogic practices, all these factors are it was dealt with yogic practices, and significant improvements were shown by yogic practices. That is most important. So one study, it gives about the mental health, quality of life, and anxiety, depression, everything. And coming to exclusive menstrual health for primary dysmenorrhea, a research in 2011, it states that 50% of female adolescents, I told you, in the college going girls, that is 13 to 18, in these age, this dysmenorrhea is quite common. And this problem with reproductive age also, those who are in the reproductive age also, they are very prone to this primary dysmenorrhea. When it comes to this practice of three poses, that is Bhujangasana and this cat and fish pose, the Matshyasana and Majjariyasana, they are able to reduce the severity and the duration. That means the intensity of the pain and the duration of the pain can be reduced due to the practice of these three asanas. This was a study conducted by Islamic Azad University in 2011, and they have given the result. And insomnia among the post-menopausal women, this is one of the study. So during the post-menopause, what are all the problems associated, and one a particular problem is insomnia. And you see, by practicing yoga, this insomnia is treated with yogic practices, and the result has been given. And of course, when it comes to women without pregnancy, if we are going out, then I'm not giving any justice to yoga practice. So when it comes to pregnancy, in Vyasa in 2005, a study was conducted, and see, yoga has given an very good result. And we all know, I can see the medical officers, those who are being a resource person, and one of the organizer also, Mrs. Elil, she in her study, she has taken this pregnancy, and in her MPhil also she has taken the study, and it is a proven fact that yoga is going to be a better part in pregnant women to have a natural birth and to have the postnatal care also. So a study is been given. And let me come to a conclusion. I should not go beyond the time. They are competent, versatile, and successful, dynamic at work, and dotting at home. They are the glue that hold many pieces of life together, and tribute will fall short of the place women hold in our hearts and societies. This is what Nora Ephron told. All these above words, it refers to women. See, they are competent. Put the word women in front, and now see, women are competent, women are versatile and successful. They are dynamic at work, they are dotting at home, and they are the glue. They are holding many pieces of life together, and any tribute will fall short of the place women hold in our hearts and societies. With this, we can understand the role of women and the importance of women, and they have to be taken care of. And see, these are something I would like to give about the importance of yoga. And anybody, anywhere, all can do yoga, and nobody is exempted. And this is why yoga will seem like a blessing for women, achieving sanity, serenity in their trying and taxing world. Yoga is going to be a mean for the women. And according to Maharishi Mahesh Yogi, see, life is here to be enjoyed, and no one has the right to suffer. This is what the word which no, really, it affects me a lot. So there is a chance of us to live a happy and enjoyable life, and then why there is a need to suffer. So take up yoga in our life. It will help us to enjoy the life, and we need not to worry, or need not to suffer. And then, so don't go here and there in searching of remedies for the menstrual disorders, my dear sisters and friends over there. And it is better to wear a good quality shoes instead of removing nails and thorns. No, and often going here for this medicine, that medicine, this, this, that, wherever no you are getting some kind of information. Don't go here and there. Better take up yoga into your life, and that is the wiser activity you can do. Don't go in search of anything else. Along with other what I can say is the alternative therapies. I'm not insisting you to go only with yoga. Along with, it depends upon your need and your problem. You can take up other alternative medicines and therapies also, but you have to be wise in choosing. So gone are the days when yoga was considered to be the magic. Now it is the only thing, the effective interventional tool for many existential maladies. So think over it. And these are all the references where I have chosen the matters. And let all know, I can even see many I'm not getting into the participant list. Only thing I can see Arivalagan sir over there, who is very keen in yoga and who is really striving hard to serve the humankind through yogic practices. I can see one male, I cannot see any other. And so with this, take time to do what makes your soul happy. Don't take the other thing which makes you happy. Your soul has to be very happy. You take time to do what makes your soul happy. Your soul will be happy only if you do yoga practices, I believe. And then whatever you do in your life, yoga is going to show you how to do it better. This is what finally I would like to say and suggest for each and every one of the participants over here. So, fairest creation of lost and best of all God's works, it is you, my dear beloved sisters and my friends, the women fraternity, the women community. Let us take a break from the demands of being a career of women, wife and mother, and let us be ourselves, right? So take a break from the demands of being a career woman, wife, mother, etc., etc. Just be yourself. Thank you so much. And now I take this time to thank the members of the management of MEGA, and my dear student and friend, I can say, Elil, and others, those who have given me this opportunity. It is very grateful and a nice time for me. And I take this opportunity to thank each and every one of the participants, without whom this presentation would not have been a successful one. Thank you so much for being patient over listening to this. Thank you, one and all. Thank you so much.
Thank you, ma'am, for your wonderful speech, which covers the life cycle, whole life cycle of the women and all the angas of the yoga and the research. Thank you so much, ma'am. Thank you. And our next chief guest of the day, who is Rama Chandrasekhar, whose topic is yoga therapy for women disorders. Let's go through her small introduction about her. Rama Chandrasekhar, who is having more than 10 years of teaching experience in yoga field, and she is one of the famous teacher in Viniyoga Healing Center as a senior therapist and yoga consultant. And as a faculty, she has conducted more than 500 hours of teachers training courses. And she has conducted more workshops for corporates as well as and for especially for the reproductive health for the women. I welcome you, ma'am. Hand over the session to you.
Thank you. Namaskaram. Today, I'm going to talk about women disorders and remedies for them in a yogic way. My name is Rama Chandrasekhar. I'm a senior consultant and yoga therapist and faculty in Vinyoga Healing Center in Besant Nagar, Chennai. I will start with a prayer to Sri Patanjali, the father of
Yes, ma'am, we can proceed.
You can hear me? Can you hear me?
Yes, both audio and video is clear.
Okay. So,
yes, ma'am, both audio and video are clear. We can proceed.
Okay. So I will start with a prayer to Sri Patanjali, the father of yoga, followed by a prayer to Sri Krishnamacharya, father of modern yoga. And then I will continue with my presentation of yoga therapy for women disorders. If there is time, I will take up questions. Otherwise, you can send the questions to our email ID, which I will give you a little later. Om योगेन चित्तस्य पदेन वाचाम् मलं शरीरस्य च वैद्यकेन योपाकरोत्तं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिराणतोऽस्मि आबाहु पुरुषाकारं शङ्खचक्रासि धारिणम् सहस्रशिरसं श्वेतं प्रणमामि पतञ्जलिं श्रीमते अनन्ताय नागराजाय नमो नमः। श्रीकृष्णवागीशयतीश्वराभ्यां सम्प्राप्तचक्राङ्गण भाष्यसारम् श्रीनूत् नरङ्गेन्द्र यतौ समर्पितस्वम् श्रीकृष्णमार्यं गुरुवर्यमीडे विरोधे कार्तिके मासे शतताराकृतोदयम् योगाचार्यं कृष्णमार्यम् गुरुवर्यमहं भजे। श्री गुरुभ्यो नमः. I also want to talk about my teacher, Sri Lara Abhishek, who's the founder of Vinyoga Healing Center. I have learned directly under him about yoga therapy, how to do yoga therapy. He has done pioneering work in the field of yoga therapy. He has trained in the tradition of Sri Krishnamacharya. He is a master of classical asanas and function-based modification. Course planning is his subject of expertise. He has designed courses for professional dancers, singers, athletes, doctors, physiotherapists, working professionals, senior citizens, and many others. Aspiring and established yoga teachers across the globe have vouched for his extraordinary methodology, both in technique and application in holistic healing, rehabilitation, and recovery. His vast experience in teaching yoga, along with Todu Varma, which he practices, he intuitively heals by realigning the body and breath and provides pain relief to the care seeker. He has developed many yoga therapy teaching courses for senior citizens, sleep disorders, women disorders, pain management, to mention a few. He is an expert in yoga therapy, and I'm happy to say I have learned directly from him. Now, Sri Krishnamacharya is known to have said, that there are 4 vidyas which should be learnt directly under a master. One is healing or maruttuvam. The second is archery or will vidya. The third is music or padal. Next comes yoga. You may learn many things from books, from information available on various platforms. Nowadays we have the internet, we have Google. So many things are available, which is very, very good because we do get a lot of information from everywhere. But you need a teacher to learn from directly, because these are all very fine things. These are all just information, and information is not useful when it comes to application. Yoga therapy especially is best learned under a master because it is different for different people. Therapy is very individualized. We call it Anubhava Yoga Sikitsha. What we do, the yoga therapy, is gained through experience. In our center, we have treated many people who have come out of their problems. And through our own experience, we have realized certain things which I'm going to share with you today. In men and women have many problems, common problems. We all know that. Whether if they have some digestive issues, it is common to men, women. There are many, many problems that are common. But women are very unique in the fact that they have to, all of them, every woman undergoes that certain stages of parinama or stage in her lifespan. We have broadly put it down into 4 stages of parinama. The first stage is when a child, a girl child, attains puberty. She undergoes a huge change physically, physiologically, psychologically, mentally, emotionally. At this stage, if she's not prepared, there may be many imbalances. The 2 important things that can happen during this time is, like previously the doctors explained, excess bleeding and irregular period. Now, irregular period, what happens is that the elimination function is not effective. It is not complete. Because of that, toxins remain in the body. These toxins in the body, over a period of time, collect and form a coating in the reproductive organ, in the uterus. This further blocks efficient menstrual discharge. Now, if this is not addressed, it can very easily become a syndrome like PCOS. Excess bleeding. What happens with the excess bleeding is the girl becomes very weak because of continuous and excess loss of blood. If this is not addressed, it can even be fatal. This is at the first stage of parinama. The next stage is when a woman gets married. There is many more changes during this time. Many become pregnant. Pregnancy has its own issues. We must realize these are all natural changes, nothing unnatural about it, but they come with a host of problems because pregnancy, there is a lot of hormonal changes. If you're not ready for it is when you may face some difficulties. Next is post-pregnancy. After delivery of the baby, again, there is a lot of change in the body, in the physiology, and then you have one more responsibility of a child. So that period, which may last up to 6 months to 2 years, is again a period of great changes. Last comes menopause, which are the twilight years of a woman, can cause great stress if she's not ready for it. None of this is unnatural. Everything is natural. It is part of the growth of a woman and the metamorphosis of a woman. It is just that to be ready for it, emotionally, mentally, and physically is very important. Like Dr. Selva Lakshmi said, this is the time yoga will be very, very helpful. There is one thing, I checked up menopause in the internet. I Googled menopause, problems related to menopause, and there were a host of them. I was quite shocked to see there were 34 different issues that women during menopause that they undergo. If they are ready for these issues, many of it can be avoided. At this stage of the parinama, a woman is also aging. It is just not that she has menopausal issues. She's also older. So she has age-related issues. She may also have other chronic issues like diabetes or hypertension. So all of it is going to make the problem more difficult to handle than just the menopause issues. What we do at Vinyoga Healing Center is that we individualize the solution. Yoga therapy is given for an individual for the problem that they face, because the same problem manifests differently in different people. So we do not address the problem alone. We address the woman undergoing that problem. So that is the way we look at solution through yoga therapy. As the Bhagavad Gita says, yoga is samatva. So a poised mind is very important. So we work on the mind also, so that it is a complete package. We work for the body, we give asanas. For the breath, we give pranayama. We give some prana kriyas for cleansing. And we give rest and relaxation for the body and mind. This is how we approach yoga therapy for women disorders. Now, what are the causes of this imbalance? Many times, the causes are in the aharam and the viharam. Aharam is food or diet. It is during the time that girls attain the puberty stage that they start eating very, very wrong food, which are not good for puberty at the stage that they are undergoing. It's the food many times which is responsible for these disorders, like irregular periods and excess bleeding. The problem is that if it is not addressed at this age, that is when it leads to more severe problems like polycystic ovarian syndrome, which will lead to infertility. Later on, depression. So if you see the Annamayam, Pranamayam, Manomayam, everything is affected. Now, Viharam. Viharam means lifestyle. Like Dr. Selva Lakshmi and the other two speakers before me, Dr. Smita and Dr. Dakshayani explained, many times women, girls who are very inactive, they are the ones who get into these problems. Yoga is a very good way to handle this portion of lifestyle. But now we are talking about disorders which have already happened. How do we deal with that? The good news is there is solution. The solution is also through aharam and viharam. The correct changes made to the diet and yoga therapy will help women to come out of these problems. The time taken to get all right will depend completely on the severity of the problem. Now, how do we provide yoga therapy? The guiding principle is Sutra number 16 in the second chapter, Heyam Dukkam Anagatam. That is protection for any future problem. This is the important guiding principle. So whoever comes to us, we correct their problem, we protect them from any future problems. There may not be any solutions to already damaged physical issues or even mental, but there is protection from any deterioration. But we also find in our experience, many women come out of these problems to lead a very, very normal life. Now, we know that these disorders directly affect the Swadhisthana chakra. The Swadhisthana chakra is responsible for the elimination function in the body, which includes the urinary function, bowel movements, and menstrual discharge. When this chakra is affected, all these issues will crop up. The solution is to focus on this chakra. There are many asanas which have been suggested for working on this chakra. Example, Surya Namaskar, Dhanurasana, Ardha Matsyendrasana, Trikonasana, Viparita Karani, Paschimottanasana. Dr. Selva Lakshmi gave an exhaustive list. Yes, they all work on the Swadhisthana chakra, and regularly doing these asanas will give protection. But those who have already ended up in a problem, when they come to us, these are obviously the asanas that we have to use. But in our experience, we find all these people with problems are unable to do these asanas. So what we do is we modify the asanas depending on the student who is doing it. To the extent that it is possible for the student, we modify it. We always fit asanas to the needs of a person. We do not fit people to the asanas. Because at the stage of therapy, we cannot fit people into asanas. If we do that, they will get, their already existing problems may get aggravated, because many people don't come only with one issue. Many of them may have neck pain, back pain, knee pain. So these asanas cannot be given to them as it is, because that will result in negative problems. It will also result in aggravation of already existing problems. So we modify these asanas. We use the correct diet. We give dietary advice. We also use breath as a tool in asana practice. We use sounds to make the asanas more intense. There are other factors in personalizing yoga therapy. When a student comes to us, we examine the student thoroughly in 4 ways. One is darshanam, second is sparshna, third is prashnam, and the fourth is nadi pariksha. By darshanam, we mean examination of the student by looking at the student. Darshana means to see. At this stage, we are keenly observing the student for any alignment issues. For instance, when the student walks inside our room, the consulting room, we watch how the student is walking. If the student is favoring one side, we know that she's got some problems either at the hip or the knee. If she's walking, putting one foot in front of the other with difficulty, we know there is some issue related to probably the knee. So this way, we observe the student in many ways. One is when they are moving, the other is when they are still, either standing, seated, or lying. We thoroughly observe them to watch them for misalignment, how they are holding the body, if there is any problem in the neck, in the low back. After doing a thorough physical observation by sight, we do what is called spashnam. Spashnam is by touch. We examine the spine thoroughly. Spine is one part of the body which is very important in yoga and yoga therapy. So corrections to the spine can be easily brought about by the correct asana with the correct breath. So we thoroughly examine the spine by touching it, running our hand through it. We also palpitate muscles because we want to find out if the muscle is weak or if it is tight. Because if you add low to tight muscles, the pain is going to get aggravated. If the muscles are weak, again, because of lack of strength, there will be pain. So we will examine muscles by touch. We also touch the joints to see if there is any swelling. We watch for any redness. So these are all important observation techniques that we use before we even develop a course for the student. Next is prashnam. Prashnam is questioning. We allow the student to talk about herself and her problem because we get many clues from the way the student expresses her own problems. Because one problem, the same problem, PCOS, will affect different women differently. So we get a very good insight into the psychology, into the mental makeup of the person by questioning. It's a deep questioning where we look at many aspects. After that, we do Nadi Pariksha. Our teacher, Sri Lara Abhishek, is an expert in Nadi Pariksha. Just by doing Nadi Pariksha, he is able to find out which organ is affected, which gives us a very good hint on which asana to use, which breath to use to correct the problem. After doing all that, we have this important shloka in a text called Yoga Rahasya. I'm only displayed a part of that shloka. It says Kala, Desha, Vayo, Vritti, Shakti. So Kala is time, Desha is place, Vayo is age, Vritti is occupation, Shakti is ability. We look at all this in every student that comes to us. When you say Kala, time, it could be time availability. We may have a set course for 45 minutes to 1 hour, but the student may not have that much time to do that course. So we look at how much time is available for a student to give a suitable course. Next is which part of the day are they going to do this course? Is it morning? Is it evening? Morning course has to be different from an evening course. Morning course outcome should be energetic so that they can face the day. Evening course should be relaxing so that they can sleep soundly. Next is Desha, which is place. The place of residence is very important in the kind of course they will be doing. If it is a cold place, they will need a practice which will give them heat. If it is a warm place, they will need cooling practice. This is an example. Next is age, bio. Age is very important. A 16-year-old will be more able to do more intense practice than a 70-year-old. We cannot have one practice for everybody. Next is vritti. Vritti is occupation. A person who's doing a sedentary job at a desk will need an active practice. A person who's all the time standing, like a teacher, will need restful practice. If you give her a lot more standing practices, she's going to be in distress. So it is important to see what occupation the student is doing. Last but not the least, comes Shakti or ability. Even amongst the students of the same age, people have different abilities. We should suit the course to the ability. Someone who's able to do quite a bit, we cannot shortchange and give them a very easy course. They will not gain much out of it. Similarly, someone who's weak, we cannot give them a strenuous course. They will not be able to do it and will not find it useful or relieving. Finally, in a nutshell, this is what we do, yoga therapy for an individual. That is a personalized practice. There is no one size fits all. First, we choose the asanas for the problem. To correct the problem, the asanas are chosen. But these asanas are not given as they are modified to suit the person. If we want to do an advanced asana, we don't give the advanced asana, but we intensify the modified asana. This is number one. Second is breathing. We do asana practice with coordinated breath, coordinated and correct breath. The components of breath are used in a natural way in the asana practice itself. Next is prana kriya. Prana kriya are cleansing practices. There are many kriyas available. We modify the kriyas also to suit the individual and add it in the course. Next is pranayama or breathing exercises. We know there are many types of pranayama which are there. Our great sages have given, but we choose whatever is suitable to the problem and the person doing the asanas. We definitely use a relaxation technique, especially for women with disorders. It is very important because the disorder itself creates stress, or the disorder may have happened due to stress. It is important to remove stress, for which they need to be given relaxation for the body and the mind. We do diet changes based on Ayurveda and Siddha to suit the individual who requires the therapy. The entire therapy course is goal-driven. It is focused on areas of need and requirement. The component of breath that we use in yoga therapy mostly is exhale. We focus on exhale component of breath, and we use sound and chant to make the sound for exhale deeper, longer, and more intense. So in essence, a course will have all of it. Asana, breathing with asana, pranakriya, pranayama, relaxation, diet changes, sound, all of this is put together for the individual, design being extremely individualistic. I now have a case study. I could have given you, there are many kind of women who come to us with many problems. I chose PCOS because this seems to be widely prevalent, and the age that the PC, like Dr. Smita said, it affects all ages. If this is caught in the bud and nipped in the bud, the results can be far-reaching and relief can be for all women. And this can be easily done with simple yoga therapy and diet changes. Now, this girl who came to us, she was about 26 years old and she was just recently married when she came to us. She had a history of PCOS. And her doctor, she went to a doctor after her marriage. And the doctor advised her to undergo a hormone therapy because she suspected, because she had a long history of PCOS. In her own words, I have her email here, which she has shared with us. It was about 12 years back before she came to us that she was diagnosed with PCOS. She had the accompanying symptoms of hair fall, acne, and all those issues. So when she came to us, we consulted, she came to us for a consultation and yoga therapy sessions. We treated her for PCOS with very simple adjustment of her diet. And we used, because she was young and quite able, we were able to give her a very, intense practice. Now, within 6 months, she got pregnant. Within a month, her period got adjusted. She was able to get normal flow. She used her irregular period. And that became regular. And within 6 months, she got pregnant. Now, she's a mother of a 2-year-old baby. She has sent us this email. If you want me to read it, I can read it, but it is there for you to see. The email is dated April 2018. So that is about a couple of years back. That when she wrote to us just after the child was born. And now it's 2 years since, the baby is 2 years now. This is only one of the many, many, many stories that we can say. Like I said earlier, today I wanted to share our knowledge, which we have gained through our own experience. Nothing speaks louder than experience. The proof of the pudding is in the eating, like somebody said. So with that, if there are any questions, you can write to us at info@yhcyogatherapy.in. info@yhcyogatherapy.in. I would like to thank the Faculty of Yoga Sciences and Therapy of Meenakshi Academy of Higher Education and Research, Indian Yoga Association for organizing this international webinar on women disorders, remedies in yogic way. I thank Edilarasi of Yogalaya Healthcare Institute for inviting me to present before this very educated and well-informed audience about my experience with teaching yoga therapy for women. My best wishes to the speakers before me and those who will be speaking after me tomorrow. I also thank Soumya Srinivasan for helping me in the preparation of this PPT. If there is time, I think there are some questions which I can take, but I'm not able to see. Can someone help me, please? 1 minute.
Yes, ma'am.
Any questions?
Just a second, ma'am.
Because there is time, maybe 10 minutes. I can't hear you.
Ma'am, there was one question which was asked, in olden days when females are undergoing the menstrual cycle period, usually they will be been apart, okay? So they will be made them to sit separately and they will be under rest and they will not be allowed to touch anything and all. But now in modern days, we are using modern utilization, and we are keep on moving and with many things, and we are upgraded. So
Correct.
there was a clarification, how is it effective, or we have to follow the traditional thing alone?
I'm sure there is very good reason for traditions, but there is very good reason for change also. The traditions are not set in stone. They also happened over a period of time. It was done for a collective goodwill. Now we have other things to help us with those things. Women do so many things during period. I'm sure we need not adopt the same things, at least in our urban setting. I'm sure in some villages, for the collective goodwill, there may be some things which are in practice. We should look at tradition and learn from it. It is there for a good reason. At the same time, it is good to examine. We are equipped with some wisdom now, so which we can use and change what needs change. Anything else?
Okay. And another thing is people suffering from fibroid. So how far it will be useful in our yogic practices?
Yoga is very useful.
Will it be advisable for them to do at that time?
Of course. The fibroids is nothing but a collection of discharge which has not come out. In fact, like Dr. Selvalakshmi said, if it is all done from younger age, say if you start yoga by 7 or something, a normal active child will not get into these problems. It is only out of inactivity. When you are not normally active, and yoga is a very good activity, because yoga is for the whole body, it is for the mind, it is for your breath. So if you take up yoga as an activity for protection itself, it is very good. But if you end up in fibroids, yoga therapy is very, very helpful. Anything else?
One last question. PCOS yoga helps for a hormone balance and for existing cysts in ovaries are cured by diet or yoga itself. Even though we know diet is important for PCOS, we just want to know how yoga supports in such a way.
No, yoga is done to correct a problem, but diet is going to play a very good role. They are both done together. See, like I say, abhyasa, vairagyam, both have to be done. There are do's, there are don'ts. In the don'ts, your diet will come because you're obviously eating wrong, so it comes in the don'ts. Don't eat this, don't eat that, but eat this. And in the do's, you will have the yoga and diet. Just diet may not be completely successful. It is very, very helpful. Just yoga will also not be completely successful. A little bit of diet will help for yoga to work very quickly and almost immediately. In our experience.
Yes. One last question. As being as a female, and almost you are in the senior citizen category, and how it would be advisable for all the females, because there was a very big question till now, though we say yoga is very effective in the menstruation cycle and everything, there was a very repeated question in their cycles when it is on bleeding time. Is yoga to be done mandatory? If so, which could be advisable and which should not be done at that time specifically?
Yeah, see, like I told you, we in Vinyoga Healing Center, we give a whole course for the individual. So for women, when they come to us, we give a course for when they have don't have the period cycle. We give a course for the period cycle, because there are some asanas you can do. There are some things which you can do which will help you during period. But there are some things which you shouldn't do. You should not put stress in the uterus area. So some asanas we avoid. Again, it is very individualistic. Like someone like me, I have been doing yoga regularly. I can do some things. But there are some people who don't do yoga regularly, but it is better for them to avoid yoga during that period. It is always individualistic. Some people are just not comfortable during that time at all, doing any activity. It is better they rest. But there are some people who are okay. They can do, it will not affect them. It is very individualistic. You must take, that is why we must always have a teacher. Yoga, you can do personally by yourself, but you will need a teacher for guidance, because the teacher can guide you for your requirement. Anything else?
Thank you.
We are almost quite late for lunch. I will let you all go. Do write to us. If you have any issues, you can contact us at the phone number displayed.
Thank you, ma'am.
Thank you so much. Thank you for the opportunity.
Yes, ma'am.
Good day.
Now I would like to invite Mrs. T. Sujata, Assistant Professor Mahir, for giving concluding address. It's not audible, ma'am. Please unmute yourself.
Ma'am, now you can unmute. You can unmute now.
Yes. Hari Om. Namaste to all. Really, actually, I'm very much honored to deliver the concluding address for this FTP program on women's disorders. And also, it is very wonderful opportunity for me to share my opinion for the previous sessions. For all these wonderful yoginis deliver their views on women disorders. The first session was handled by Dakshayani. Actually, thank you, ma'am. You told the causes for infertility, both men and female are in equal. Actually, 30% they are both are responsible for infertility in equal. Because I see many cases coming only women to yoga, not many of the men are not coming to yoga. I insist them to practice, to come with your spouse also. Actually, you also told that there are equal possibilities in men and women, and also you explained very well manner about the increased by practicing yogic practices, blood flow increases, and then the side effects will overcome. But for the fertility drugs, and then hormonal imbalance also increased. That and all you explained very well manner. Thank you, ma'am, very much. And the next session, Smita Arun. She explained the basics of Ayurveda, woman Ayurveda. Actually, regarding women, she explained very well manner, and also she showed some of the remedies, and then what are the ways to follow for the woman to in periods time, and then during pregnant time, and also PCOD, what are all the do's and don'ts. She explained very well manner. The third session was handled by Selvalakshmi ma'am. She explained all the yogic practices, including yama, niyama, asanas, pranayama. What are the? She recommended some very good asanas, that grivasana for this one, fertility, and also some very good asanas for irregular periods, and pranayama, mudras, bandhas, and also she explained the importance of Mahamudra. Then she told that if you don't have time to practice full yoga nidra, you can practice what she told, abdominal breathing. Yes, it is true. If you do abdominal breathing itself, it relieves the stress, and also It is good for irregular periods and anuria, dysmenorrhea, everything. Okay, all women disorders. Thank you, ma'am. Then coming to next, Rama Chandrasekhar, ma'am. She explained in her way that Heyam Dukkha Managatam, that is what is importance of food and breath, sound. She explained very good. And then how to give yoga therapy, that is individualized yoga therapy. How to diagnose, and then for whom and which, how to modify the asanas to fit into the people. She explained in a very well manner. Thank you, ma'am. And for all the yoginis have done very explore. Many of we got some light on yogic practices. Each and nook and every corner you all explain. Thank you very much. And also I thank to Yogalaya Healthcare Institute, Indian Yoga Association, and Meenakshi Academy of Higher Education and Research. And also my special thanks to Dr. Elungovan sir for giving this opportunity. Thank you very much. Namaste.
Thank you, ma'am. Now I will invite Ms. Shalini, PhD scholar of MAHER, to give the vote of thanks.
Good afternoon to one and all. I would like to thank the organizing partners of this event, Faculty of Yoga Sciences and Therapy, Meenakshi Academy of Higher Education and Research, Yogalaya Healthcare Institute, and International Yoga Association for making this event a wonderful one. And also, I would like to extend my thanks to all the guests of honor today, Dr. Dakshayani, Dr. Smita Arun, Dr. Selva Lakshmi, and Dr. Rama Chandrasekharan for sharing their knowledge and wisdom on their respective field, which was really an eye-opener for all the women out there to keep their health upright. I would also finally would like to extend my gratitude to all the participants for being patient enough and cooperating us to make this event a successful one. Thank you.
Thank you very much, everyone, for your wonderful cooperation and support till the end. And we'll see you tomorrow in another aspects of you with all our special guests. Thank you, one and all. See you tomorrow.